Call this meeting of August 17th, 2021 to order. Tonight, we have one of our members, Lakshmi Balachandra, on Zoom, so I'd like to pull her up. And there's Lakshmi. Hi, Lakshmi. We appreciate all the patience from the viewing public as we try to get used to this technology. How are you?
Hi, everybody. Thanks so much.
Perfect. There you are. Nice to see you.
Nice to see you. Well, I can't see you, but nice to be here.
Great. Okay. So first item on the agenda is a public hearing, Eversource grant of location, 21 Rosemary Street. Joanne Calendar via Zoom. Ms. Calendar.
Hi, this is Joanne Calendar. Can you hear me?
We can hear you. Good evening.
Good evening. How are you?
Great. How are you?
Wonderful. Thank you.
Great. So you're here on the petition for Rosemary. The floor is yours to describe the request.
Thank you. I too am trying to get used to the being remote. So please bear with me just 1 second.
Okay. Yes, you don't have video at this time, but we will be patient.
Thank you. So yes, we are seeking a grant of location to install approximately 30 feet of conduit into Rosemary Street. And this is to provide new underground service to 21 Rosemary Street.
Okay, Ms. Calendar, do you have video available on your connection?
I'll be honest with you, I'm not sure how to, I really don't know how to make that available to you.
Okay. Oh, okay. Okay, but this is permitted, is that correct? To have audio only is permitted? I just want to make clear for the public. Okay. Okay, Ms. Calendar, please proceed.
Yes, so as I say, we are seeking the grant of location to install approximately 30 feet of conduit into Rosemary Street. And again, this is to provide underground service to the customer at 21 Rosemary Street.
Thank you. Mrs. Patrick, everything is in order?
Yes, it is.
Thank you. This is a public hearing. Is anyone here to be heard on this application? Seeing anyone on Zoom, please raise your hand. All right. Seeing and hearing none, is there any discussion from the board or questions from the board? Hearing none, is there a motion?
I move that the select board approve and sign a petition from Eversource Energy to install approximately 30 feet of conduit in Rosemary Street.
And I second.
Motion second. Any discussion?
Just one question.
Yes,
Where
Mr.
this
Matthews.
is a hybrid meeting, do we need to vote?
We
Roll
have to
call?
roll call.
We have to do roll call. Yes.
Do that as
Mr.
a roll
Matthews.
call. Very good.
Okay. Okay. Any further discussion? Okay. Ms. Balachandra,
Yes.
Mr. Nelson,
Yes.
Ms. Cooley,
Yes.
Mr. Matthews,
Yes.
and the chair votes yes. Thank you.
Thank you.
Next item on the agenda, grant of location, 100 Lawton Road. Ms. Calendar, again, the floor is
Yes.
yours.
Thank you. So Eversource is seeking a grant of location to install approximately 9 feet of conduit into Lawton Road. This is necessary to provide new electric service to the new customer at 100 Lawton Road.
Thank you. Everything is in order?
Yes,
Mrs.
it is.
Patrick? Great. This is a public hearing. Is there anyone here who wishes to be heard on this application? Seeing and hearing none. Board, any questions for Ms. Calendar? Okay, is there a motion?
Yes. Motion that we approve and sign the petition from Eversource Energy to install approximately 9 feet of the conduit in Lawton Road.
Second.
Motion and second. Any further discussion? Hearing none, we come to the vote. Ms. Balachandra,
Yes.
Mr. Nelson,
Yes.
Ms. Cooley,
Yes.
Mr. Matthews,
Yes.
and the chair votes yes. Thank you again, Ms. Calendar. Have a wonderful evening.
Thank you. You all do the same. Bye now.
Next item on the agenda, COVID-19 update. Mr. McDonald and Ms. Zeik. Mr. McDonald is the Director of Health and Human Services. Ms. Zeik is the Assistant Director of Public Health. All right, and we have everyone in the room. Terrific. Okay. Tim, thank you for joining us. Tiffany, thank you for joining us. Clearly, a very important issue, especially considering what's happened over the past month or couple months. So if you could please, the floor is yours, provide an update on COVID-19 and the Delta variant.
Sure, thank you. So Tiffany and I are going to jointly present this information. We did have a presentation that went into the select board's packet, which was also actually updated by our epidemiologist, Hannah Whitehead, with some new data late on Friday night. So a new version was sent, and this is the new version. If we could go to the first slide. There has been a lot of media attention about the surge in COVID cases with the Delta variant, and I think this first slide helps to sort of tell the story of where we've been since the start of the pandemic and where we are now. Obviously, where we are now is in the lower right-hand corner, August 2021. And you can see that we certainly are, our case volume is certainly up from June and July, but we want to understand it in context. And right now, the context is that it is comparatively a low volume compared to some of the places we were. We were not in a particularly great place in Needham or across the country in January 2021. And we would very much like not to get back to a place like that. But just want sort of to set the stage to show that even though we have had an increase in cases, it is still a relatively small volume compared to where we've been. Next slide, please. The purple line here is our average daily incident rate adjusted for population. So that's adjusted per 100,000 people. Oops, my screen shows a little bit of, there we go. You can see our cumulative cases, which is the shaded area. And you can see the very slight uptick that you can see over the last month and a half or so. But our average daily incident rate is just over 13. We had hit a high of 52.3 in mid-January 2021. So we certainly are concerned in the public health division. We're monitoring the situation and certainly looking closely at the data and the cases we are seeing. But it's still within the context. It's not nearly as bad as it was previously, and we want to sort of keep that in mind as we worry about it. The other thing that is important to know is that because we have a significantly vaccinated population, and we'll talk a little bit more about that in a few slides, cases going up is not necessarily indicative, as it was in previous waves, of hospitalizations going up and deaths going up. In previous waves, cases would go up sharply, and then a week later, hospitalizations would go up sharply, and then 3 to 4 weeks later, deaths would go up sharply. Right now, what we've seen, and I have to add the caveat, in vaccinated communities, so this is different than in some areas of the country where there's a substantial number of unvaccinated people. But in vaccinated areas of the country with the Delta variant, what we're seeing is that cases are going up at a strong clip, but that hospitalizations are going up at a much more gradual slope, and that deaths are barely trending up at all. So that's a very positive sign. Before, we were very worried about cases overwhelming the hospital system and lots of people dying. And now we're certainly concerned about all of those things, but they're not as directly connected. Cases could go up, but if hospitalizations don't go up substantially, that it's not quite as intense as it was before, I guess, for lack of a better word. Next slide, please. This shows where we were. I had mentioned that in January, mid-January, we hit a positive rate for cases of 52.3. Right now, we're just at 9.5 over the last 14 days. There are two sort of different ways we measure data. One is the CDC, which looks at that 7-day rolling average. This one here is the data that the State Department of Public Health uses, which is the 14-day rolling average. You can see where we are for positive tests, positive testing rate 1.56, which again is far less than half of what we were in mid-January. I would show you the chart on the left, the table, I guess, on the left. We're always concerned about trends. And so we look at Needham and we look at the Commonwealth of Massachusetts, and we think about neighboring communities, and we think about our neighboring counties, since Needham is in Norfolk County, but sits next to Suffolk and Middlesex counties. And right now we're seeing a consistent picture, which is cases and positive testing rate are going up across the board. So that's something we, again, want to be aware of and we are concerned about, but it's not something we're alarmed about. We understand sort of in context that this is a relatively modest increase in cases, and we're going to sort of observe that and sort of be aware. If I could go to the next slide, please. Thanks. Tiffany, do you mind going over the confirmed COVID cases that we have?
Sure. As you can see, of our average age of confirmed cases over the last year and a half almost now, Hannah greatly split those up for us so we can see the average age per month. And it really did start at a high and now has come down with those cases based off who's unfortunately getting positive from COVID. But if you look at the left-hand side here and see August 2021 and July 2021 and see our differences, you can see there are some portions that have strong parts, but in August 2021 right there, we have a large grouping for our 5 to 18-year-olds. So that is the concerning area for us right now, especially as school starts up. Our average case age is 41.8, and this is through the last year and a half total, but a pretty decent split in all of our age groups throughout the entire, if we take the average age for all of our 1,800 cases we've had. Next slide.
And just one thing, if I could just briefly go back to the previous slide, I think we might have had a missing data set, so we can certainly update it in the packet information, but the N equals value in May was 19, in June was 3, in July was 36, and in August was 33 so far. Tiffany, I know one of the things that a lot of people are concerned about are cases in children, which is our next slide, because children under 12 are the group of the population that has not been eligible to date for vaccine. And I know a lot of people are concerned about that as summer winds down and schools begin. So can you tell us a little bit about what we're seeing so far in cases amongst young children?
Sure. Cases that have been reported through our team that Mary Fontaine continues to lead for us has mostly been, when it's within children, it's mostly been because they're unvaccinated, unfortunately, so they spread. But what we're seeing within that spread is that it comes from another unvaccinated person. There's rare occasion that one of our vaccinated cases has a strong enough case that they infect somebody else, whether vaccinated or not vaccinated. So that is what we're seeing at that point in time. We are monitoring the trends and looking at the data as far as hospitalizations and how severe. But from my understanding, so far, only one case has been a concern with needing medical attention, and it was due to asthma concerns. So as far as that goes, thankfully, none of our cases we have seen recently are getting severely ill, even in our younger children.
Thank you.
Mhm.
Next slide, Kristen. Breakthrough cases, and Tiffany, I'll have you lead this one too, because you helped me understand this context. So can you tell us a little bit about breakthrough infections?
Sure. So in tracking the breakthrough infections, the state data didn't pull in. We have two different state systems when we're doing contact tracing. We have the MAVEN, which is where we do the core of the contact tracing. We get notified of our cases and when they come through. And now with vaccination rates, we have the state MIS system, which is where all vaccination data for residents of the state of Massachusetts go. So back in between May and June, they were able to merge those two together so that MAVEN pulls information from MIS. So from May through now, we're able to look and see where our vaccination rates lie and our vaccinated cases come through. One of the concerns we keep seeing through different groups is the change between each week. So if you look at August, so far total cases is 33, but 17 of them are breakthrough cases and vaccinated. So far in August, 52% of our cases are vaccinated, which makes sense because Needham is close to 80% fully vaccinated for all our residents in Needham. So our percentage in that realm is going to be high each week, but we're looking for breakthrough cases. So we're looking for total vaccinated residents comparative to the total cases that have been vaccinated. And that number, so out of our 23,000 residents who are fully vaccinated, only 99 of those have received COVID, or sorry, only 51 of those have received COVID since getting vaccinated, which gives us a 0.22% of all of our vaccinated residents who have developed disease, which is great for us because we're able to know that our vaccinations are working within the town of Needham. Our residents are being kept safe by the vaccine. And the little pie chart on the right side is our breakthrough cases by vaccine. So it just kind of shows that which ones have been more, have seen more cases, and our Pfizer has had the most vaccine breakthrough cases. I don't know that this is anything particular because, again, to know the full true rate, we need to test everybody who's vaccinated to see who's had it. But this is just a little snapshot of what we're seeing.
Tiffany, you were pointing out to me that when the initial data was coming out about the effectiveness of the vaccines, specifically the Pfizer and Moderna mRNA vaccines, you were talking about an effective rate of 94 or 95%. And right now what we're seeing is that much less than 1% of cases are breakthroughs. So it looks like the vaccines, like you said, are working quite well. Next slide, if we could. So Tiffany alluded to this, and it looks like, unfortunately, we might have to do a PDF to maybe take, later on, we have an animation in one of the slides. And so we liked doing it as a PowerPoint, but I think maybe we'll need to do a PDF so that all the values are clear. Approximately 16% of the town is under the age of 12, so they're not eligible for vaccination. Right now, when we look at the total population, Tiffany referenced 23,303 are fully vaccinated. That represents 80% of Needham's population. And I will add a caveat here that that is the data the state and CDC are currently using, which is 2010 census data. The 2020 census data, which was released a few days ago and which hasn't been parsed down to a very finite level in terms of demographic and age breakdowns within each community. The 2020 census data is not yet being used for these statistics. So when you look at the town's population, about 80% right now are fully vaccinated. Partially vaccinated are about 7%. And we know that kids who are not yet eligible under the age of 12 make up a decent chunk of the town's population. The reason those numbers don't add up, the 80% plus 7% plus 16% is more than 100, is because the town's population has grown and we don't yet have the updated 2020 census numbers. So one thing that we can anticipate is that our vaccinated rate, when the denominator changes, because right now our vaccination rate of 80% is based on 23,303 people who are fully vaccinated divided by the town's population. We know that the town's population is going up in the census. So one thing we know is that this rate will tick down a little bit from 80%, we anticipate. On the right-hand side, the chart shows you in green the fully vaccinated individuals across the different age groups, as well as the partially vaccinated individuals. And I would caution to say that partially vaccinated means that they have gotten at one point or another one dose of the 2-dose vaccine, the Pfizer or the Moderna. So it's not necessarily to say that they will never be fully vaccinated. For some of those people, it's that they have not yet been fully vaccinated. Although for some of them, it is that they got one dose of the vaccine and for one reason or another decided not to get the full dose. Next slide, please. Vaccine uptick in youth. I think this is an important slide, and it's one of the reasons that we're feeling cautiously optimistic about the upcoming academic year. I know that the superintendent and the Joint Health and Safety Committee are looking at COVID data very closely, but it's one of the reasons that we're feeling good about the coming academic year. When we look at the percent fully vaccinated amongst 16 to 19-year-olds, that's the red line, we're having about 90% of those folks in Needham are fully vaccinated. When we look at 12 to 15-year-olds, it's at 86% and it's still going up. That's a very high rate, and we're really pretty happy to see that. We do have a couple bullet points about missed doses are steadily declining amongst the 12 to 15-year-olds. So we were worried a little bit that there were a large number of 12 to 15-year-olds who hadn't gotten their second dose. And what it seems to be is that there's a data lag or something that wasn't initially converting the people who had got their second doses to fully vaccinated in the system, but that's catching up. So we don't have a large population of youth that have not gotten their second dose. We're at a very high vaccination rate amongst that group as well. Next slide, please. One of the things I talked about, and this always, the downturn at the end is something we have to explain. So if you look at the top left, we see a chart from August through now, about a year's time, looking at cases in blue and hospitalizations in orange. You can see, and I just want to caution, this little downturn in cases, that's all at the end of August, is always going to happen, because the number of cases that are going to happen on August 10th, we don't know for sure until 3, 5, 6, or 7 days after for all the testing results to get in. So whenever you pull this, you're not going to have all of the data yet for the last day. It makes sense intuitively when you think about it. But one thing I really want to highlight for folks is that you can see how hospitalizations went up fairly sharply in line with cases when we're talking about the fall of 2020. And we look in the lower left corner, we see the May to August trends. We can see that hospitalizations quickly dropped with cases, and that as cases went back up, hospitalizations have increased much more gradually. And that's what I was talking about a little bit earlier, where we're still monitoring cases, but we don't know if it's quite as critical to say we have 20 cases versus 10 cases if those cases are sort of decoupled from hospitalizations and deaths. The acuity of the illness is not as severe, and that's a really good thing for all involved. Next slide, please. Here's statewide data, and this is only through June. Tiffany, can you talk us through this, and particularly also why it's only through June?
Sure. So this one, part of it goes through June, part of it goes till now. So if you look at the left, the 7-day average COVID hospitalizations, this one's up to date because this is just hospitalizations as a whole. This is anybody who's been hospitalized with COVID. So it's the same thing. As you can see, the trend, as we saw earlier, is that you had those sharp rises, but then we have a slower increase as we're coming through April, May, June, and July of this last year. On the left-hand side, you'll see the average age of hospitalized cases, and that one did have to stop at June, kind of goes up a little bit in July, but only because the state stopped producing age-related data to children and hospitalizations as of June 30th. So we don't have any up-to-date data on that one. So the average age for hospitalized care kind of takes a stop right there because we don't have the true data. So if you go to the next slide, that would be the same information about the teenagers. So also goes through June. And if you look at these, you've got our 0 to 19 and then our total average cases. Those are our, children cases in the blue, and the average, all the rest of the cases in the red.
Tiffany, on the previous slide, there was a text box in blue that I think had important information, which is we've only recorded 2 hospitalizations since May, and both of those have been in people in the senior age bracket.
So yeah, so that's what's been put into Maven. I can't promise that data is currently up to date as far as what's been put in, but that's what we have seen. That may not necessarily be what the state or each hospital has recorded, but that is what we have done when we've done case investigations. So yeah.
That's an important caveat. Okay, can we go to the next slide, actually, the one after?
One more.
So you can see a chart, percentage of hospitalizations, and you can see that it unfortunately does drop off at June. We don't have a clear explanation from the state about why they stopped providing age-specific hospitalization data. It's something that a lot of folks in local public health have been asking for additional information about, especially as the lower age brackets take up a larger share of the total COVID case burden because they are the unvaccinated population. So it's sort of an ongoing source of concern that the state has not yet provided this, but there are a lot of people who are sort of asking for it, and I hope the state will eventually respond to that information and provide it. So we have a couple more slides to quickly go through, and I don't want to take up the full time. Looking at hospitalizations, and this was something the Board of Health was particularly interested in, was the age hospitalization data that we did have. So we looked particularly at April through June, and you can see a pretty clear trend of hospitalizations going down, which is great. And you can also see the age breakdown within that group. And I think that the most obvious noteworthy trend in that is that the dark gray, which is the 15 to 19-year-olds, goes down as they become eligible for vaccination, as does the 10 to 14 is not a clear age cutoff because part of that group is eligible for vaccination, part of the group is not. But they also decline from large shares here on the first 2 weeks of May to a much smaller share by mid-June. Okay, and I think we've got 3 more slides after that, I think. Just briefly, county level data. So we're looking at Norfolk County confirmed cases and deaths. And again, you can see deaths have been relatively flat over the last 4 or 5 months, while cases have continued to trend upward. Here in the bottom right is a zoom in for just the last 4 months. And again, you can see that deaths have been relatively flat while cases have rebounded. While it may not sound it, that's very encouraging for people in local public health, in large part because we do care about the health and medical system and we don't want it to be overwhelmed. But when we start to see a graph that looks like this, we start to see something that looks like seasonal flu, something that is serious and should be, precautions should be taken, but maybe which doesn't constitute a full emergency. So we're in sort of a transition period where COVID is a full emergency. And many public health experts think that we're going to eventually get to the point where COVID is a seasonal occurrence that happens every year, but it is manageable. And unfortunately, there will be some people in the law of large numbers that will have serious health outcomes. But for the majority of people, if they're vaccinated, they may get COVID, but it won't have a significant health implication for them. And that's certainly our hope. Next slide, please.
Oh, sorry, I wanted to touch on the blue box on the last slide, but it just states that we have had no COVID deaths since mid-April, which is also enlightening and enheartening.
Yes, that was one of my least favorite things in the pandemic, calling the town clerk to talk about whether there had been any new COVID-related deaths. And it's been a better conversation recently. Next slide, please. There are 2 sort of different stories right now. I think people are probably aware that the CDC has issued guidance in the last 3 or 4 weeks about areas of substantial or high transmission. The State Department of Public Health has not issued the same guidance. The CDC's guidance is to recommend that fully vaccinated individuals, in addition to certainly unvaccinated individuals, wear a mask in indoor settings if you're in an area of substantial or high transmission. Norfolk County counts as one of those areas. Needham, if we were just looking at the Needham community, CDC only looks at counties, but if we were just looking at the Needham community, we would also fall into the substantial transmission category. But the CDC sort of has 2 measures here. They have substantial transmission, and we're in the orange range. But when we look at positive testing rate, we're in the low transmission range. So our data is sort of telling 2 different stories. And I think in large part there's relation there between vaccination status, but it's just something we're aware of. Next slide, please. So this is an animation, which I think is somewhat helpful. It looks at parts of New England, southern New England, and looks at community transmission levels by that CDC categorization. This is by counties. So you can see as we progressed from July through August that the map does go from low and moderate transmission of cases to substantial and high. It's just something we sort of want to be aware of. Certainly it's helpful for me as a visual learner to sort of see and understand. Next slide, please. These are the current CDC recommendations. So CDC is recommending that in indoor settings, even fully vaccinated individuals, if they are in a area of substantial or high transmission, they should mask. Even if they're not in an area of substantial or high transmission, the CDC is recommending that people who are in high risk categories or who have high risk, people in high risk categories who are in their household, maybe a spouse or a loved one who is immunocompromised, that those people also choose to mask. CDC does recommend universal indoor masking for K to 12 students and staff. Right now, there is sort of pretty clear differences between the Mass DPH guidance and the current CDC guidance, where Mass DPH has sort of left a lot of decisions up to local determination and hasn't followed this latest sort of set of CDC guidance. So I think those are the last slides. We could stop the presentation, and Tiffany and I would be happy to try to help answer questions that the select board may have.
Tim, thank you so much for all this work, and Tiffany, an incredible amount of data and analysis and charts, and obviously we can't get to all of it tonight. A couple of takeaways I heard, I think, from you when you started saying this is a concern, the Delta variant, but not an alarm stage yet because of people who have been vaccinated and the hospitalizations, and there is some, I think, silver lining in these numbers. I have a question before I turn it over to the board, actually 2. Number 1, do you anticipate any new guidance coming from the Board of Health in the next, as we get towards school and town meeting, any new or updated guidance from the Board of Health?
Sure. So the Board of Health actually met last Thursday to talk about a number of communities in Massachusetts, a small number actually, who've implemented indoor mask restrictions in sort of all indoor settings, not just schools, but post offices and coffee shops and the like. Right now, the Board of Health doesn't believe the Needham data warrants that. It certainly is going to continue to monitor the situation. The CDC measure is fairly static. So it says if you have this level of transmission, then you should take this step without any regard for the fact that there's a substantial difference between a community like Needham where about 80% of the town is fully vaccinated versus a county in another part of the country where the vaccination rate is sub 50%. There are really substantial differences between those communities, and the Board of Health thinks that that's something we have to take into account. It's certainly going to continue to monitor the situation, and it's not something that the board takes lightly, but right now the board, and we do have a meeting going on right now, but right now the board is not looking at an indoor mask mandate. The board is going to encourage, and I think the superintendent is already moving in this direction, the schools to use masks in large part because there are substantial numbers of school-age children who are unvaccinated. Obviously, all of those under 12 are unvaccinated, while kids in middle school and high school might be vaccinated. Hopefully they are. We know that the Needham numbers show that about 85 or 90% of them are. We do also know that they may have siblings or friends that are in those unvaccinated categories. So right now, the initial recommendation that I believe the superintendent will present later this month to school committee would be that the schools start with masks required for all students and all staff, regardless of vaccination status, but that would be assessed on a regular basis to determine whether conditions continue to warrant masking for all of those groups.
Great, thank you. And then just as a follow-up on that, because we all speak with parents, I know that is the concern, those unvaccinated children, people who work with children. Do you have any update, or you read stories about when the vaccine might be available for children, younger children? Do you have any confirmation on or an update on when that timeline might be?
There's no
What the
official deadline. I do know that about a week and a half ago, the CDC asked Moderna to expand the size of its clinical trial for children to look at a broader pool of safety data. I think my hope, and when people ask me about things during the COVID pandemic, I will say consistently that it's very hard to predict things. If I'm being charitable, if I'm not being charitable, I'll say I'm consistently wrong. But predictions, I think maybe by mid to late fall, we hope that the emergency use authorization for the Pfizer and Moderna vaccines will be extended to children under 12, potentially 5 to 11, or there's even a potential 6 months to 11. That would certainly be a real big advance, because obviously that would cover your elementary age children and then the kindergarten and pre-K as well.
Great, thank you for that discussion. Marcus?
Yeah, thanks, Tim, and thanks, Tiffany, for your update. Question for you about, I guess, as CDC and mask kind of differ as far as policy, what is our policy for schools in the sense that if they're fully vaccinated, they come in close contact, and that quarantine process and how it may differ from what we have here?
Sure. So I will tell you that the state on Friday, the Department of Elementary and Secondary Education and the State Department of Public Health came out with revised guidance to help schools and school districts understand and local health understand what they're recommending in terms of who qualifies as a close contact, what conditions, what symptoms would qualify someone to potentially have COVID-like symptoms. I will tell you unofficially that when the state has a political appointee present that information and doesn't have the state epidemiologist who's on the call say anything about it, that makes me raise my eyebrow just a bit. So I think right now the public health division staff and the school health services staff are assessing whether those recommendations make sense. I would tell you that the recommendations generally fall in the, we're doing everything possible to keep our kids in school, which is a good thing. I think we could all agree on that. But it would mean that we ignore a lot of things where a youth who is at the YMCA who presents with symptoms would be considered someone who'd have to quarantine if they were a close contact. But if that person was in an elementary school earlier in the day, they wouldn't be a close contact. So we think that sort of dichotomy doesn't fully make sense, that the nature of the child doesn't change whether they're in an after-school program or in school itself. So I think we're assessing that, but I think I've talked around the issue, but clearly I'm not yet comfortable with what the state is recommending.
They put in a lot of caveats into what is and what isn't, and making that determination about what's best for Needham and as a whole with the students is going to take a little bit of time to figure out. So we are working with Susanna Hahn, the school health director, and we will work with Mary Fontaine and the teams to really see what works best to keep the kids safe.
And just following up on that, is there a timetable for that when you might have an answer as far as before school starts, or when you're going to kind of report back to everyone?
Definitely before school starts.
Okay,
'cause
just
we'll need to
making
make sure we know what we're doing.
All right.
And hopefully this week, it's just trying to do ABC, because the state right now has laid it out as A goes to A1 to B to A2 to A3, or you go to B1, B2, or B3, or so just trying to figure out which portions are appropriate. But yeah, definitely be soon.
Thank you.
Thank you. Further discussion?
Yeah, I
Dan?
have a couple questions. Just to be clear, when we say breakthrough, this means a person has tested positive after having the full dosage, whether that's 1 or 2, depending on the vaccine and the time after that. There's somebody that's fully vaccinated.
Yes, that is correct.
Okay. When I'm trying to kind of understand the math, looking at the charts and stuff, I get the impression that we had, and these are positive tests, about 30 positives in July on an order of magnitude, and about 30 so far in August. Is that a correct read?
Yeah, I think it was 39 and 33, but yes.
Okay. And noting that's only half the month, so we're headed higher. Now, and this is just to state my understanding, that it would seem to me that some of the numbers don't give us as concise a picture as we might otherwise have, in the sense that at least based on the epidemiology, the unvaccinated, the younger people, particularly kids that are under 12 who are unvaccinated, as well as generally people on the age continuum that are younger anyway, are less likely to actually have symptoms or serious symptoms. So it's likely to suppose that we may have a fair number of people, some unknown number, who actually have the D variant, and we don't, and nobody know, or have had it or have it, and we don't know that.
Or completely asymptomatic. Yes, that is certainly the case. There is an unknown number. We don't know the sort of size of that iceberg.
And the same is likely to be true, as I understand this, of vaccinated people who have breakthrough infections, because the breakthrough infections are generally not as serious as if you weren't vaccinated, as I understand the press coverage of this. And so again, we may have some of those cases and not know.
Yes, it's absolutely true that if you're going to get COVID, we strongly suggest you get vaccinated and have a breakthrough case rather than be unvaccinated. Because
And I'm not faulting anyone with this. I'm just trying to try to understand the numbers. And then of course there's the whole problem, as I understand it again. I keep saying as I understand it because this is science is not my thing, but I've tried to understand it for the work here. That people who are vaccinated and actually immune can still carry and spread the D variant for some period of time, because the viral load is fairly substantial, and if they pick it up from some other person, they can be carrying it around in their respiratory system, and until it actually tries to infect them, their antibodies don't react, and they can be spreading as well.
Yes, it's certainly true that people who are vaccinated can spread. They are less likely to spread COVID than someone who is unvaccinated. And certainly if you are asymptomatic, you're much less likely to spread the vaccine rather than someone who's symptomatic.
Okay, and I think we said it's a little speculative as to when vaccine approvals are going to be available for groups of people under age 12. At this point, we're looking in the fall, but have nothing clearer than that.
The only thing we know is that safety trials are underway. And as I said, I think it was 2 weeks ago or maybe 10 days ago, FDA asked Moderna to like double the size of its trial pool. because they wanted to see more data.
And a related question is, if we get to the point where groups of people under age 12, whether it's the 5 to 12s or some large, some group that includes younger ages, do we have the capacity for a rapid rollout in Massachusetts of that vaccination?
Massachusetts as a whole has that capacity. I would tell you that we were frustrated. We received vaccine for a period of time, and Tiffany and the team of public health nurses and medical reserve corps volunteers that she assembled did an absolutely amazing job setting up very efficient clinics. If we get vaccine, we can move very quickly to set up vaccination clinics. So our hope would be that if the emergency youth authorization is extended, that we would receive vaccine and we would move within a day or two to set up clinics, working closely with the Needham Public Schools and with, as Tiffany referenced earlier, Susanna Hahn, who's the Director of School Health Services.
And who has the supply? The state?
The state and the feds. There were multiple channels where vaccines were pushed out. So there was a federal pharmacy program where the federal government directly provided pharmacies with vaccine. There was state allocations, which were then distributed to healthcare systems, community health centers, hospitals, public health. So there were multiple sort of streams of vaccine flowing into the state. It's certainly
yeah. And just to see, is it your understanding that if the approval comes through for some groups under age 12, it'll be that the state has the capacity, including the inventory or ready access to inventory, to move that out pretty quickly?
That is less clear, but they do have vaccine on hand right now. And presumably if or when an EUA is extended, the feds will begin pushing out more vaccine through those channels that they had. The feds and the state will begin pushing out more vaccine. So that's a little bit of an assumption on my part. Tiff?
The state has said on our state calls on Tuesdays that they do have a plan for if boosters are approved. So I imagine that they would also utilize some of that supply if the younger children were approved before the boosters and things like that.
Okay, and then just to be clear, this board is not directly in charge of the schools. That's really the Board of Health that's setting the policy, and the superintendent and the school committee are deciding, making decisions based on this guidance, including what the CDC says. But I'm certain that people are going to ask us what's going to happen in 2 weeks when the schools open. What I'm hearing is that the simplest thing to say would be that they should expect that all students, whether vaccinated or not, are going to be required to be masked when they're in the buildings, and that as the situation develops, there may be reviews as to whether or not that can be, those rules can in some way may be relaxed, whether that's for older students or vaccinated staff or whatever. But that at the outset, they should expect that everyone is going to be required to wear a mask in the Needham Public Schools indoors.
That's the recommendation that the superintendent will give to the school committee later this month. And given that there are school committee members who discuss that with Dan regularly, I think I would hope they would approve that.
Thank you.
Thank you. Thank you, Dan. Lakshmi?
Thank you. And thank you very much for all the data, Tim and Tiffany. That was great. I am a scientist. I'm a social scientist, but I'm actually married to a biologist, a microbiologist. And so one of the things that we've been hearing is because the virus is, it's aerosolized, like it is definitely, air transmitted, and that, even vaccinated folks can transmit it. We're already hearing of schools that have opened in even places that were requiring vaccines. For example, USC has already stated that there's been high transmissions, right? So I think we are headed into an area that is looking very scary for our kids with the start of school. And so I had a couple questions related to school that I know the school board and the superintendent can decide, but just questions that I had for you guys to think about in terms of school is, one, are we going to have a dashboard similar to last year so that we can get transparency for the number of cases and the uptick in cases that are potentially going to happen through school spread? And two, is there any plans to take advantage of the state's testing? Because the best way we know, right, is to test and isolate rather than, just relying on symptoms or symptomatic testing. And before we get, aerosolized like classroom spread. I think the other risk therein is also the cafeteria, right, or lunch. And I don't really know what the plan is. The superintendent has already notified us that mask wearing will be required. But frankly, I'm not sure how effective mask wearing will be, given most people only have cloth masks and don't have the KN95s or the N94s, et cetera. So I guess my three questions to you, or things to think about, are we getting a dashboard, particularly for schools, and what kind of reporting? And then what steps are being made to take either advantage of the DESE, I think it's called, right? The pool testing or individual testing and isolation program?
Sure. So right now that the town does still have its COVID dashboard, which pulls both Needham specific regional and state data. That is in place. The schools last year tracked closely cases within schools. They didn't distinguish, but they did say, like this elementary school, 1 case, this elementary school, 2 cases type of thing. My understanding is that will continue. I don't want to make promises for other people until they explicitly say it, but my understanding was that was going to continue because it was the feedback from school committee, and I think from parents in the town, was that they found that information valuable. And that's something that the school nurses keep updated after consultating with the public health nurses on cases. DESE is offering 3 different pool testing options, 3 different testing options. And Needham is signing up, although it is not immediately implementing any of the 3. One of the things, so you mentioned pooled PCR testing, and pooled PCR testing is very valuable. What the best data tells us right now is that given Needham's vaccination rate, the number of false positives would be 4 to 5 times the number of true positives. So that's a cause for concern, especially because positive test results in kids being outside of school. I think there's some question about whether we could supplement with Binax Now or symptomatic Binax testing, so rapid antigen testing for symptomatic individuals. And I think those are sort of under exploration. The state is offering them for free, which is very valuable. And the state is also saying you can pivot between each of the 3 depending on your circumstances, which I think is also very helpful. One of the things to remember is that free is sort of a relative term. There's sort of a lot of staff time and effort that's required to administer it. And one of the things that's also important to remember is that if you're doing pooled testing at a syndromic level, so you're trying to for surveillance level, you really need participation rates at 85 or 90% for it to be worth anything. If you have participation rates of 73%, you may as well not do it. And I think that that's something we have to keep in mind. A lot of private secondary schools and universities are requiring, as conditions of attending the school, that people have to take tests. I don't think that's something that Needham is in a position to do. So it's certainly still under evaluation. There was a subcommittee that the superintendent put together with the former chair of the Board of Health, who's current member of the Board of Health, Kathleen Brown, myself, the director of school health services, one of the assistant superintendents, the school physician, and 2 members of the school unions to talk through that. And we had given an initial recommendation of not yet implementing testing. I think that's still sort of to be determined, given that we have a few more weeks, given that our cases are going up. So I think, I don't want to say what we will do next week until we have the data that shows what next week is. I do want to say that we're sort of making choices, and the schools are making choices in a way that they're keeping their options open, and they're not precluding anything. So by signing up for the DESE system, we could opt into any of those 3 options at any point. That gives us some flexibility. And certainly it's a combination, right? So if potentially the cases faded in the community, maybe there's an option to implement testing but reduce the requirements for masking. Or maybe we don't want to touch masks at all, but we still want, because cases have gone up, we want to implement testing. So it's kind of a layered approach, right? We had talked last year about the layered approach of distancing, masking, some of the choices that people could make to try to keep themselves safe if you put 2 or 3 strategies together. And I think that's the same case here with testing.
Oh, no, thank you, Tim. That's very helpful. And I think that's absolutely right with the prior data, right? But given the new data of what we know about how Delta is spreading, And I just wanted to add, I completely understand that it takes so much of, staff time and the implementation, but I think there are ways that we can help. And I know that there are lots of people in the community that would be willing to volunteer their time. Parents, I know I have several, medical school friends who are very interested in helping roll out this effort for schools. So, we're happy to help facilitate that as well. If it could mean that we could get testing implemented, even the Binax tests or the state testing program, I think there'd be a lot of support to help roll that out.
Mhm. The Public Health Division did sign up to have Binax tests available, especially for, because right now what we're hearing is that there is more limited availability of testing than people would want. I think that's not particularly surprising, right? The state, as cases went down, scaled down some of its testing and contact tracing capabilities, and then cases started to go back up, and the state's kind of playing catch up, trying to scale back up its capabilities. So the Public Health Division does have that capability. The school nurses did sign up for the eBinax Now system, which was offered at the end of last year, although DESI has not indicated whether it will support it in this coming academic year. It's really trying to funnel people away from that towards the three options it presented rather than the option it gave last year. The other thing that the town has, which is beneficial certainly for occupational level exposure, is that the fire department has done testing for staff who have an occupational exposure within the context of work, both on the town side and the school side.
Great. Thank you very much. Mary Ann?
Thank you, Tim. I appreciated a lot of the breakout of particularly the kids' age with some of the various vaccination data. I find the 0 to 18 bucket to be big in the first chart, just in terms of understanding it. I wondered, the breakout that you gave of the breakthrough cases by vaccination type, do we have data about by vaccination type of the overall vaccines given in Needham or received by Needham citizens? I'm just trying to understand how those numbers compare to the overall population.
So I would tell you, given that Pfizer is the only one that's available for people under 18, I would tell you that our breakdown is probably, and the only Johnson & Johnson that we have given has been for homebound people, which was a very low volume. I think it was 100 people total. So for us, we believe the breakdown is something on the order of 10% Johnson & Johnson, 30 to 35% Moderna, and 55 to 60% Pfizer. So I think we should caveat to say that that's not an indication that Pfizer is ineffective. It's just more people in Needham receive the Pfizer vaccine. Therefore, of the cases that are breakthrough, more of the people naturally would have a breakthrough with the Pfizer vaccine. So it's not a measure of the efficacy of either of any of those vaccines.
That was what I was trying to be sure I understood. So I appreciate that point. Thank you.
Thank you, Mary Ann. And Tim again, and Tiffany and the whole department and Board of Health, we thank you for the, oh, and before we close, Marcus?
Yeah, just one more question. I know you mentioned briefly the 8-month booster. And I know in a few months, we'll probably be approaching that for who's been vaccinated, back in the February, March, April kind of time frame. And I know Tiffany briefly mentioned there's a plan for that. So where are we proactively on that plan for how we roll it out in Needham? And I guess the idea of, what we can do to kind of be ready for that if and when it happens.
Sure. So I think a lot will depend on how the state wants to set up its vaccination clinics. The clinics that Needham ran were open to everyone. So we had people from 210 cities as well as a couple of states. So, a lot of Massachusetts, not just the town of Needham. So I think one of the questions would be, is the state looking to push out vaccine through local public health? And if so, is it looking for Needham to, for lack of a better word, to vaccinate our clients from before? So we would reach out to them because we have all their contact info. Or is it looking to sort of say, Needham and a lot of other sites are open for boosters and you can sign up wherever you want? I think they would go towards the latter strategy. I'm not positive. On Saturday, the state sent out information about booster shots for severely immunocompromised people. And that's maybe not what we would think of as general immunocompromised, or severely immunocompromised, for example, transplant recipients. So right now, the understanding is that the state would likely push that vaccine out to doctor's offices and inpatient hospital settings, because the acuity of those patients is such that it's not appropriate for them to be sort of queuing up in a gymnasium altogether to get their vaccine. They really need to get it in a appropriate clinical setting. But if we're talking about boosters, because it's been 8 months, that is a broader swath of the population. Certainly, we know that there were public safety people in the first group, then there were the 75 and older, then 65 and older, then under 65 and teachers and other public facing staff members. So if the 8-month booster is available, we would be happy to offer clinics, and we'd be ready to do that sort of any way, shape, or form, where we have the sort of mechanism set up, we have the staff hired, we have the plans, we've adapted the plans, and we'd love the opportunity to implement them. So if vaccine is available, we're going to be the first in line.
Thanks, Tim.
Thank you again. And I know we're going to be discussing a couple requests with ARPA money later on in the agenda. But again, thank you for all you do, and look forward to the updates, and hopefully there'll be positive updates as we move forward. So have a great evening.
Thank you for your time.
Thank you. Is there a motion for the appointments and
I'll move
consent?
the appointments in the consent agenda, Mr. Chairman.
Thank you. Is there a second?
Second.
Any discussion? Marcus,
Yes.
Mary Ann,
Yes.
Dan,
Yes.
Lakshmi?
I'm sorry, I did have a question on the consent before we vote. There was something about a flag, I believe. I was curious what that was.
Okay, give us one moment.
It was a donation of a flag, right?
Yes, it was. What's your question, Lakshmi?
Do we know what flag it is? Is there-
Usually it's the American flag. Mrs. Patrick.
Ted Shaughnessy, and I believe on behalf of the Rotary, donates the flag that flies at Avery Square, and they replace it whenever it needs it. The American flag.
Thank you. Yes.
Thank you. Okay. That's great. Dan,
Yes.
Mary Ann,
Yes.
George, Marcus, okay, and
Yeah.
the chair votes yes. Thank you. That's unanimous.
Double yes.
Double yes, great. Next item on the agenda, facility finance update, Mr. Davison. And just by way of background, Marion and I are on a facility master plan committee, which involves members of the finance committee, town staff, Dave, of course, members of the PPPC, CPC, and others, in trying to get some direction on where we go with the school projects, school administration, as well as the Pollard and Mitchell projects. And the committee asked at that time to come up with different financing scenarios to see where we would be depending on which direction we took. And this evening, we're going to hear about some of those scenarios and background. And the floor is yours, Ms. Davison.
Thank you, Mr. Chair. Mr. Chair and the members of the board, I come before you to discuss the memo that was dated July 21st, 2021 to the town manager and copied to the various boards in town. The purpose of this memo and the analysis behind it was to address how proposed and requested capital proposed to be financed by debt, either in full or in part, would impact a couple of measures that the town has with its debt policies, as well as our understanding of what the impact would be on the average taxpayer for those projects that are contemplated to be presented as a debt exclusion, and if approved, would have an increase in individuals' tax bills. Specifically, we look at two of the policies that the select board has long adopted, and we refer to them shorthand as a 3% in the 10% goal. The 3% measure is the town has a policy that it will set aside or reserve 3% of recurring general fund revenue for the purposes of financing general fund cash, general fund debt finance capital. The 10% ratio is where we look at our total debt load, what our annual debt service is compared to total revenue. And again, this is recurring revenue, and that is 10%. The 10% takes into account the general fund revenues, general fund debt, CPA revenues, CPA debt, water and sewer enterprise fund debt and water and sewer enterprise revenue, and debt exclusions in the debt exclusion revenue that comes in. With that, Mr. Chair, I take that information and then lay out assumptions, which first looks at projects that have already been approved and are ongoing. The assumption is that each one of those projects will be completed and that the full authorization will be necessary in order to complete the project. Of course, the projects can't exceed the authorized vote. So there's so the maximum that can be spent is the authorization. Under that, we have approximately approximately $22.5 million of authorization that may still be borrowed. And again, to be clear, that's authorization that's both, that's general fund, excluded debt, water debt, and sewer debt. At this point, there are no projects that are open that still have a CPA component to it. With that, there's also a number of projects that are identified in the town's 5-year capital plan. The most recent version is the capital plan of 22 to 26. And in that, there were 10 projects identified with a total cost, if they were to be approved as presented in the plan, of $105 million. Over the next 5 years. In addition, there are 2 other projects that are in the plan, specifically the Mitchell and Pollard schools. And in that, usually we look at just the plans as they're submitted. But in this case, we were asked by the school department to look at 2 different options that the school committee were presented. They were presented multiple options, but 2 of the options they identified options C and D from their school master plan, and look at the impact that that may have on those ratios, and of course the impact on the tax bill. Depending which scenario was taken, that has a total project cost between $263 and $291 million. Now, when I mention these numbers, these are all gross numbers. This is before you take into account the state aid. For instance, the school projects are contemplated under one option that both the Pollard School and the Mitchell School would move forward with the MSBA participating. And in another option, only the Mitchell School would be moving forward with the MSBA assistance, and the Pollard School would be financed without the state's participation. So those are the projects in the gross dollars involved in looking at the impact. The other assumptions that are taken into account, as I stated, that the projects that are out that are currently approved and ongoing, that the full appropriation will be utilized. In the case of these projects that are pending and are the focus of this analysis, the assumption is 100% of the authorization would be expended as identified. There are timelines associated with each of the projects, which I won't lay out into detail, because as we narrow them, I will come back with much more concise figures once decisions are being made. And we look at interest rates. Interest rate assumptions here are with projects being bonded within the next 18 months would be carrying a coupon interest rate of 6%. And beyond that, the assumption is 7%. As noted, the town has seen interest rates and the coupon rates in the 2 to 5%. Most recently, the town issued a bond, a 20-year bond that was approved back in April, and that had coupon rates between 2 and 5%. Generally, the higher interest rates tend to be at the beginning of the bond issue when you have more debt, and hence the interest expense is much greater than in the out years where you have less principal that you're paying interest against. We take those numbers because of the long-term nature of these projects that clearly, if we were borrowing within the next 6 months or so, we have a better handle in terms of forecasting where interest rates are likely to be. But we're talking a window of 3, 5, 8 years before these final bonds, and to be more conservative so that we have a better sense of our affordability, that some of these bonds will not be paid off until the year 2061. So it's a number of years out, and it's prudent to go with a higher interest rate. And as the board members know, that's what I have done traditionally and have not swayed from that practice. In terms of the impact on the average tax bill for those projects that are identified to be funded by an excluded debt, as has been done traditionally, we look at what the cost of debt service would be using the single tax rate. What that means is that what the estimated tax would be on the average single family home if we didn't transfer any of the tax burden from the residents onto the business community, which the town of Needham has been doing that for a number of years. The reason that I have traditionally used the single rate is because it's not as straightforward. There is a cap of how much taxes can be transferred from the residential properties to the commercial properties, and the town is at those limits. And if you have a situation where residential values are growing faster than commercial values, which has happened a number of times over the last 30 years, what effectively happens is some of the taxes that were being paid by the business community actually come back to the residents, or in other words of saying it, you can't transfer as much of the residential tax burden onto the commercial. So with the single tax rate, that is the most conservative because it will never be lower than that. And the view is an informed taxpayer going to the polls to vote, if you're showing them what the upward level is of the tax burden and they're making that choice on it, there's no surprises. And as the board has known, I am not aware of any taxpayer that has ever come before the board to the select board to yell at you for not having taxes as high as you thought it was going to be. So, and those are all the cautions that are built into these assumptions. Now, based upon these rates and the different options, there's several scenarios. And in each instance, we do have debt service within the general fund, the 3%, where there are several years that if we did the projects as laid out here in the time frames shown, and that we spend 100% of the authorization, that we would exceed the 3%. So we would have to look at ways to make adjustments. One of the ways which the town has done is set aside fund through the debt service stabilization fund in order to reduce that burden in those years that that the forecast looks to show that we'd be over the 3% threshold. The second factor is the 10%, where we have a number of years where we would be over the 10%, where over the 10% now. We went into this eyes wide open, again, with the assumptions of interest rates, but it was understood because the community made priorities in terms of projects that had to move forward, and the town did. And lastly, the general fund, this is meaningful only to the general fund within the 3%. The revenue growth rate that we relied upon is what traditionally we have relied upon in terms of growth rate, in which a 30-year window is shown has been through good times and bad times, on average 4.5% is the growth rate in the general fund revenue. That of course means there are years slightly higher, there are years slightly lower. With that, I have also provided for the board's and the town manager's consideration, a number of different scenarios with different interest rate assumptions that range from 4 to 7% in different revenue growth assumptions, lower, 80% below the average and 120% above the average in the general fund. So with that, Mr. Chair, I will stop and take questions the board members may have.
Okay. Again, Dave, thank you and for your team for all the analysis that you put into this. I guess the takeaway, I want to know one of the questions, we talk about school administration and Emory Grover was whether or not that could be done within the limit without going for an override. And I think with your assumption, I know it would push up on the 10%, which is, as you said, we're over it now and it's a soft cap, but it helps us keep our AAA bond rating, right? But that it could be done. I know it's a school priority and we're still in discussions as we make our way to town meeting where that's going to fall. I did notice also in that plan, the Jack Cogswell building, there could be potentially a large turnback, but there's also been discussion on whether or not that should be used for solar for that building. So that's going to be another discussion that we will have along with the finance committee as we move towards town meeting. But with that, I'd like to open up for discussion to the board. Marcus?
Yes, thanks for coming, Dave. So question right now, and Matt mentioned, and you mentioned as well, that we're nearing the 10% cap or pushing right up against it. So when that happens, how do we determine how much, I guess, falls back to from the business to the residents? And I know you mentioned how it hasn't happened often, but sometimes the growth of the residents and what they pay may outpace the commercial, and that happens. So can you just talk about that and what that would look like if we were to exceed that 10%, which we're right up against right now?
That 10% is looking at total revenues,
Okay.
Not just property taxes. So that's the water and sewer, CPA, as well as the excluded debt. The shift, you can't shift portions of it. It's not as though as the debt service can be shifted more onto the business. It's the total tax levy in the portion of the total tax levy that can be shifted to the commercial. That's also paying for the day-to-day schools, the day-to-day public works, day-to-day public safety, day-to-day public health and health and human services. So it's not specific to the debt service. The items that, those years that the debt service is above the 10%, that's above the town's desired goal not to exceed, but in terms of the impact, it would proportionately impact all taxpayers. It's because if we add another $1 million to the tax levy for the year, the $1 million will have to be paid by all the taxpayers. It's just a question of what portion of that. Currently with the shift, it's about 15% of the levy is paid by the commercial sector and 85% is paid by the residential sector. So in that scenario, 150,000 of the debt service would be paid by the businesses and 850,000 would be paid by the residents. But let's say the residential values were to increase substantially more on the percentage basis than the commercial sector. And let's say now this shift in terms of the burden between commercial and residential, that the residents are paying 87% of the total levy and the commercials are paying 13%. Therefore, in my $1 million assumption, 130,000 would be paid by the businesses and 870,000 would be paid by the residents. If it was a single tax rate, we would be looking something in this hypothetical scenario, it would be 900,000 paid by the residents and 100,000 paid by the businesses.
If it was a single tax. Okay, thank you.
Thank you, Marcus. Questions? Marianne?
Well, I think the only point that I would make is definitely that those two things are different. So it might be worthwhile just to look later at some numbers so we can just visibly see how those two things are different. The other point, Dave, that I think is valuable to make is the cost of the school projects, if they were all to be incurred at the same time, first of all, would definitely exceed the 10%. Okay, but would essentially double the debt burden of the town compared to the current debt burden. Correct?
That's correct.
So part of why we set the 10% is because we're trying to maintain a level of burden that we think is affordable. And affordable is a tricky word, right? As you know. So the notion of doubling that debt gets to be complicated for many citizens in town and puts at risk our AAA bond rating, which gets us a lower interest rating in the first place.
Okay.
So it's all pieces of a puzzle with how we put it together and try to stagger this timing to control the debt
It's not all
level.
at the same time.
Yeah.
In a sense. And then I just had a
Yes,
follow-up.
Marcus.
And when we're talking about Mitchell and Pollard and how the state may help fund that or may not, how and when is that, I guess, determined? And we see if there's one situation where both would be partially funded or hopefully, and then there's another one where just Mitchell maybe and Pollard would be without that funding. How is that determined? And when have we began that process?
It begins with the school department submitting a statement of interest, I believe the report is called, where it looks to begin a conversation with the School Building Assistance Authority, to which would participate in funding. The town would fund it, and there would be reimbursement for part of that cost by the state, a feasibility of what makes sense programmatically, as well as the state takes into consideration of cost, depending what the project is, depending upon bonus points that the town could receive. If the identified project is determined, there would be a percentage of the construction cost that would be eligible for reimbursement. And we would know that before the town voted on that. For the purposes of these exercises, I had assumed a 20% reimbursement rate.
Okay, 20. Yeah, I just wanted to know what that would look like for people that are watching, wondering like how that process would work. And I think that's important to know that we would know that ahead of time before we actually, I guess,
Yes,
committed.
the community would know that there are upfront costs that could be entirely on the town. If there are upfront costs that could be 100% on the town's dime if we don't proceed with the project or if it was rejected.
Okay.
But at the time that the voters are going to be asked for a project, we would know what project the MSBA would partner with us, and we would know the approximate percentage that we would receive in terms of the construction cost. And the reason I say approximate, because based upon final designs, which always will happen after the approval of the project, there are certain bonus points the town receives, such as green initiatives. We received some of those extra bonus points with the Williams School, for instance.
Thank you, Marcus. And I will say the MSBA funding issue to me is going to be imperative how we move forward with this, as Marianne spoke about spreading these projects out, because both Mitchell and Pollard will need an override because of the size of that project, the size of those projects. So all of those, again, are pieces of the puzzle on how we proceed. Marianne and then Lakshmi.
So the other observation I was going to make for people who don't know about the MSBA process is that the MSBA typically will only work with the town on one school project at a time.
That's why we had that alternative.
So again, that's another thing. So we've finished working with them on the Sunita Williams School. Now we would be able to submit another project when they reopen their SOI process. It's not currently open, so we're waiting for it to reopen. And then we can submit a project to have a discussion with them about, and we have to be accepted. So we may be rejected. So all of those are factors that come into play.
A lot of moving pieces. Lakshmi?
Thanks.
Thank you. Thank you, Matt and Dave. Thank you for the presentation. So I went through the numbers, and each of your scenarios does have the projects being financed with Emory Grover as an assumed inclusion when you're going through your option scenarios. And I guess I'm curious if there's a chance to revisit that by putting either, Mitchell or Pollard ahead of that financing. And I recognize that the debt burden can change, But the other side of this coin is that our, interest rates are so low right now, and it does seem like an opportunity for the town to take advantage of that, and maybe not doing it as a lump project, or doing 2 for 1 at the same time in order to even out the debt process here. So I'm curious if you've done forecasting with looking at, Mitchell now, particularly since I noticed in the plan that you are also looking to finance, immediate remediation of some of the restrooms or the air conditioning at Pollard, for example. So rather than doing this Band-Aid process for the next few years, if we could go ahead and update the schools, considering the demographics and the changing, and I recognize the tax base is increasing, right? It seems like a good time to look towards that direction first. So I didn't see that in the scenario planning. So I'm curious if those scenarios have been done without including Emory Grover first.
The short answer is yes, we can redo the timeline on the projects. This was done based upon the timelines that were submitted to us for consideration. And this is basically at the start of the process. And based upon this memo, different boards, school committee, the finance committee, the select board, CPC, which would be a partner for the Emory Grover building if we were to move forward, may adjust these timelines. And if that were to happen, I would certainly update the plan to reflect this.
Right, and just to add, the order, or I should say the priority of these buildings is set forth by the school committee, and among our working group, they have been clear, and I think they're going to discuss it again and vote moving to town meeting if Emory Grover's their number one priority, which it seems like it is, and then it'll be up to this board as we move towards town meeting if we want to support or not support the article. I do know that, I know we've received a lot of material about the amount of deferring and deferral on that building. And the schools, from what I hear and speaking to the superintendent, feel that the priority is now to move forward with doing something with school administration. But if that were to change or a scenario gets brought up, then of course those numbers could be run based on the prioritization. Marcus?
Yeah, and then also a question that wouldn't hurt to have, Dr. Gudigans or some people from the school board in to kind of talk to us and let the people kind of hear the process and kind of went behind it. Because I know the board that you and Marianne are on, as well as so many other people, have done work and have done things to kind of get to this point. So to have them come in and kind of share, I think would be really helpful as to how we determine that that's the number one priority, and they were able to ask questions. But I think that'd be helpful to kind of just see that process. So I'd recommend.
I think that's a terrific idea. And I know as we move forward to town meeting, if this is the priority for them at Emory Grover, they're going to come and explain the article. But I think that's a terrific idea to hear it directly from them on why they think this is a priority. And also, I know the invitation's been put out about a tour for this board to look at and see the conditions, which some of us are familiar with and some of us not so much. So I've been there in a little while. So Dan?
Yeah, and this has come up under this item, but we've seen quite a bit of discussion in the past week about changes or arrangements to the town capital process, including a kind of casual suggestion that the Emory Grover building is just a place where 50 office people work and that it's no big deal and could be deferred. It's a lot different from at least my point of view, and we have a system in town to do capital planning, because what Dave said is very important. These are big dollar items for buildings that are intended to last for 50 years at a time, and they better, because there's always something else that needs to be done. And you've got to set a course and you've got to stay on it, because if you change direction, that has costs too. The Emory Grover building is the school administration building, has been for a great many years. It's not something that in some of these comments I've seen that why has this been made a top priority? It hasn't been a top priority. It's been deferred for decades as conditions in this 120-year-old schools, originally high school structure, have really deteriorated, and particularly because we keep deferring, because we say we're going to come back and do it all at once, as Dr. Schmidt said in another context. The most recent iteration of this began 5 years or 6 years ago now, when the town pulled together a community summit, because we don't make these decisions, as you said, Mr. Chairman, by ourselves. We work with other volunteer boards and committees, staff, consultants. There's a lot of different kinds of input that comes into this, and that all has to be squared off, or it's a very high cost and very inefficient process. And at that time, they settled on a group of 8 buildings to work on. Of those 8, 5 are completed, 2 are in process, and the Emory Grover remains, in part because it is a deferred priority, and in part because it presents some very difficult challenges. It's a very old building, and working on an historic building has high dollar per square foot costs associated with it. In order, from the school department's point of view, it's not just office space, it has meeting rooms and a lot of other functions that go on in there, and it needs to have extra space added on. Building an addition onto an historic building adds another level of complication. On the other hand, it does have the advantage that it is about 1/3 of the size of some of the larger things that are looming on the horizon that are not ready to move forward at this point, because the Mitchell and the Pollard, we certainly want to at least make a full effort to arrange to secure state subsidy funding for those, and then plan as to how those are going to fit into the town's capital plan, because it's a lot of dough. I think Dave gave a perfect answer to your question, Marcus, about what happens if if we exceed the 10% in the percentages. But for me, I had to try to answer things to still a little more, to simply say, we have a certain amount of revenue every year. And unless the town votes to give us more, or we get a windfall from some other source, that revenue has to pay for everything. And it breaks into 2 categories. The capital, which are the buildings and construction and debt service that we have, paying the bonds, and we use the bonds to stretch the cost of the projects out over a long period of time, and the operating costs. And the operating costs are the salaries and the heat and the light and everything else that we have to do. If you go over a certain, for any, and there's a percentage split, no matter what, of how much each year goes to operating and how much to capital. The reason for that 10% guideline is you're saying if you go over that, you're putting pressure on how much money you've got on your capital. Has gone up to the point you're putting pressure on what you can do in operating, whether you want to, are you able to have your pay raises stay in place? Are you able to pay for provide services that people want, or add staffing? It gets very tight. And unless you want to go back for an override or you get a windfall, it gets tough. So that's the reason that there's one of the reasons that there's enormous amount of planning that goes into this. So here we are after 6 years of planning on the Everett Grover. The issue is not, are we going to defer it or make it a high priority or come back to it some other time? It's, are we going to do this or not? And in the warrant that we'll get to a little later on this evening, there's a request to go to town meeting, who in this system that we have is the deciding authority on whether it approved $1.5 million of bonding, so that we can take this into feasibility study and figure out the exact designs and get it ready to go for whatever steps to be taken next. Town meeting votes no, that's the end of it. And we'll have to think of something else to do with the building, and we'll have to think of something else to do with the administration. But in terms of, is there some urgency to this? We got today, because these questions had been asked, we asked the superintendent, give us some information about this. And I completely agree with you. I believe we need to, because this questions have been asked of this board, the superintendent, senior representative of the school department, and other boards and committees, including the Permanent Public Building Committee, should be able to come in here and present to us and make this case, because yes, people have a right to understand what the rationale is that supports all this. But what the superintendent said, just to give you the in the last paragraph of this pretty thorough and compelling summary was some pretty striking photos of some of the conditions in the building that have been deferred for 40 years of work. The Emory Grover building has anchored the north end of town center for 120 years, first as the town's new high school and eventually becoming school administration, providing vital in-person services to family and staff. However, without a plan to renovate the building, we must vacate the structure due to continued lack of accessibility. That's handicapped access, which is basically zero, for reasons of health and for reasons of health and safety. It would then be demolished, resulting in a gaping hole in the neighborhood and a loss to the entire community. It is past time to make a decision about the Emory Grover and school administration. There's need for space that is welcoming, efficient, safe, and sound. That's Superintendent Gudikant's. And I know from working on the facilities and the bricks and mortar of this, I concur with that view, which I think is the view of the dozens of people working as volunteers and staff members that have been involved in this for years. The superintendent can speak to the fact of how this affects the staff, the parents, and the children that need administrative services from our central administration, and what the options and costs are. And it would be great to have the superintendent come in. Thank you.
Great, Dan, thank you. And I think we're in agreement, and thank you, Marcus, for that, to have them come in and explain the need. And whoever, if you haven't seen the FAQ that was put out, please go to the website and you'll be able to see, and hopefully it'll answer some of your questions. But it has been part of our long-term capital planning. And as we, again, deferred, as we talked about in one of the 8 projects, as you mentioned, Mr. Matthews, and I think the time is now, but we don't have to make that decision tonight. We'll have more information on it. And then we will eventually have to make a decision.
I would like to say
Yes or
something.
no? Yes, Lakshmi.
Before we move on.
Yep.
I recognize, Dan's point that this has been in the works for a while, and I recognize the superintendent's, description of need. But I also would like to recognize that the schools, particularly Mitchell, have had serious problems. And, things change, frankly, and, it has been deferred for years and years. There is no dire reason, in my opinion, and to the many parents I've talked with, that the school administration building needs to be revisited, particularly, as Dan mentioned, it will be an increased cost because of the, historic attributes of the building and whatnot. That does not require the school administrators don't need that level of building or occupancy, particularly now, but our school kids do. And so that, on behalf of the many parents that I would like to give a voice to tonight, Mitchell certainly needs to be moved up, as does Pollard, ahead of an administrative expense. And even if it has been on the list for a while, there's a new government here. We're representing different voices, and we would like to be recognized in terms of the changing demographics of this community and what people want now. So thank you.
Thank you, Lakshmi, and your point of view has been heard, and we will be taking this up with the schools and have a discussion with them before we proceed further. But again, where I'm sitting, the time is now to get this done. I think we have planned around this, but let's have the schools come in and answer some questions, and then we'll have to vote it one way or the other. But thank you for that statement. And with that, I would say thank you, Dave, for coming in, presenting that financing plan. If members of the board have questions, you know where to reach Dave. As always, appreciated. Thank you. Next item on the agenda, town manager.
Thank you, Mr. Chair. First item is an item that was deferred from the July meeting, which is updating our list of special municipal employees. We have a recommendation for adding 6 committees that had either been added since the last time the board updated the list or had their names changed. And then we had quite a few committees that no longer exist. So we'd ask the board to vote to approve the additions and the deletions that are contained in the fact sheet. I did, after having questions, Mr. Chair, by the board, did send you examples of the special municipal employee designations of a number of communities, including Brookline, Weston, Lexington, Wellesley, Arlington, and just to give you a sense of, they're pretty similar to the kinds of committees that we have.
Thank you. And really, the intent is to protect our citizen volunteers. And right now, currently, they're under the assumption that they are protected, and some business owners here, the ability to go before certain boards and committees. And also the examples you gave us, I think, makes a lot of sense. So what I would like to do is hear if there are any motions, and then we can have discussion on those motions as we move through them. So if we can start with the motion,
Sure,
we'll take it
Mr.
from
Chairman.
here.
I have a question.
Hold on, Lakshmi, just wait till the motion is second, then we can have a discussion. Yes, Mr. Matthews?
Yeah, it's, if you're ready for the.
Yep.
I didn't know if the way that this process works, as I understand it, we have a list of positions that are categorized as special municipal employees, most commonly of volunteers who work on one committee that might have some other business with the town. And that is in a, but involves another part of the town's work, that they continue as volunteers on that committee. But that requires approval from this board. And there's a list of such committees and positions. What we have is the staff has gone through and identified a list of changes in terms of additions, committees that have been created since the last time that this was voted on a number of years ago, and some that have been dissolved and therefore no longer necessary. So those changes are all presented as individual motions in the draft. And my question is whether or not, when we get to that part, do you want to have them moved and voted separately?
Yes,
or-
I would, Mr.
Okay, well, then I'd be prepared to read them and offer them as motions in order at the time that we get to that point.
Thank you. Can you make a motion, then we can have a
Sure.
discussion on the first?
I'll
motion.
move that the board vote to designate the position of trustee of the Affordable Housing Trust as a special municipal employee pursuant to the general laws, chapter 268A. And then if that's seconded, I'd like to speak to that.
Okay. Is there a second?
Second.
Okay, Mr. Matthews and then Lakshmi.
This is just to clarify my understanding. The Affordable Housing Trust is a trust that we have, but only 5 of the members of that trust of the trustees are the members of the select board. We cannot be
Mr. Chair.
special employees
in the
under any
case-
circumstance.
In the case, actually, I'm on that too. So
Yeah,
if you have status as a regular municipal employee, none of them would ever be treated as special municipal employees.
okay, so
Even
this
if they're
is,
served,
this only affects.
there are
the-
regular municipal employees serving on some of these boards.
Correct.
Yeah, so this, in this instance, would happen, I'm just flagging it because of that particular point. This actually affects only the status of one person
That's
who's not otherwise a regular municipal employee.
Thank you, Mr. Matthews. Ms. Balachandra?
So I guess I'd like to start. I don't understand doing this line by line. As I mentioned in our last meeting, that I think this is raising a lot of conflicts of interest in general. And by having this designation, I think is a slippery slope for all of these. And I would like to say that I'm a little concerned that our chair is currently leading this discussion, because there is a state ethics probe violation, et cetera, for our chair, as well as for his colleague, which is one of the committees on this list. And so I do think this is problematic that we are having this discussion when we are currently in a conflict of interest situation, given the governance of these boards and doing business with this town. So either I would like to make a motion to not have any of these designations, because this is, as Dan rightly points out, an individual by individual basis. And I'm not sure we can have this discussion when we have an ethics violation and a conflicts of interest presented to us currently with our current board makeup and members of these special committees. So my motion is that none of these should be given special municipal designation. because we are already in a slippery slope and we're in an ethics probe already.
Okay, thanks, Ms. Balachandra. We can't get your motion right now because we have a motion, a second. You can make that motion afterwards. I will say your comments could not be the furthest from the truth, but I do not want to talk about any of that. I don't think it's appropriate to discuss that at this moment. I will say that the reason we are taking them in order is because, as you can see by the list, these votes would not affect anything until we get to. I'm speaking, Ms. Balachandra, please. I asked for a little decorum here.
I'm disagreeing with
Thank you.
that
So I know
statement,
you're
so-
entitled to your opinion, but right now I have the floor. So when we come to 7, I intend to recuse myself as far as it is a vote to put all of the slate forward to the town clerk. So is there any other further discussion on number 1? Hearing none, I come to the vote. Mr. Nelson? For the board vote to designate the position of trustee of the Affordable Housing as special municipal employee.
Yes.
Ms. Cooley,
Yes.
Mr. Matthews,
Yes.
Ms. Balachandra,
No,
and the chair votes yes. Thank you. Ms. Balachandra, we can come to your motion if you wish to make it.
I would like to make the motion that none of these special committees should be given a special municipal designation, given the conflicts of interest present and the possibilities therein. So I would like to take this vote off the table.
We have a motion. Is there a second? Yeah, go ahead. You can second it for purpose of discussion. Yeah, absolutely.
Yeah. So
We have a motion and a second by Mr. Nelson.
I second.
Yes,
it.
Mr. Nelson.
Yes, I second.
Yep, discussion.
Yeah.
Yeah.
Let him talk and then I can come to you, Mr.
Okay, I
Matthews.
just, kind of a point of order. From my point of view, the motion is put, I would take this to be a motion simply to eliminate the special municipal employees list entirely. But it's also framed with some inflammatory, and I think Marcus just wants to talk about this. I don't think I'm not sure that he wants to be, it's up to Marcus as to whether or not he wants to second this motion in its current form. I think under the circumstances, usually you'd require a second before you discuss, but this may be a little different.
I guess what I would say, Ms. Balachandra, before we come to that, can you restate your motion so that it encapsulates without the editorializing what you would like out of this motion?
The editorializing was merely putting on the table the conflicts of interest that are present and could.
Understood. Asked and answered. I'm
Right.
asking you to restate your motion, please.
My motion is that I would like to not have any special municipal employee designation for those who serve on boards and committees.
Thank you for your motion. Is there a second with that restated motion? Mr. Nelson.
So I'll second it because I still have a
Okay,
question.
discussion, Mr. Nelson.
Okay, so what I'm asking or what I want to know is with everything that's going on as far as ethics and whatnot, is there a possibility of coming up with a code of conduct or something or putting that in place in order to make sure that we're following everything to the letter, to the T, so we're able to do this and continue to have the special municipal committee still be active, municipal employee to be active. So just if we put something in place and we have, check marks, we know exactly what we can and can't do. And that's what I would like to have in order for this to continue is what I'm saying. So that's what I was trying to get from Lakshmi and ask to you as well.
Okay, and yeah, Mr. Nelson, it was in our goals as well, I think, to have a code of conduct manual. And I've looked and researched and spoke with town council. And I think some of us have looked and researched on other towns who have, appointed committees and what they do if there is a question, how they can approach town council, what the decorum should be, how to speak to the chair, all of those things, what they can and can't do can be outlined in a code of conduct. I wholeheartedly agree that the time is now, especially as there is turnover in new members, to understand what they can and can't do. I will just say that the list that we have of employees with this current designation, it's current. So it's not like we are adding to a group, but the actual slate that it already applies to would be under the impression that they are under that designation. And I think without some type of public hearing or further discussion, to remove that designation, I think would be completely unfair. But I guess you know where I am on that. Ms. Cooley, I want to.
I would just note that I think Ms. Balachandra's motion is challenging in many ways, because if members of the town are participating on town committees, for example, and they also decided that they wish to have a stop sign at the end of their street, they would not be able to go before another board of committee if they served somewhere else without this designation. If we had a business owner in town who was serving on a committee and needed to go before another board, something related to their business, again, would not be able to go do that in the interest of their business, separate from their service on that board of committee. What I do think is important to recognize is that all municipal employees have an obligation and are required to comply with the state ethics law. That applies to both regular and special municipal employees. So I think there is value in having this designation. I think that we can provide more clarity as it's apparently needed with respect to a code of conduct. But I think there's a reason for having this, so that people can do the work that they need to do to assist the town on these boards and committees and to live their life in town.
Thanks, Mary.
Thank you. Mr. Matthews.
Yeah, I'd like to speak to this and maybe repeating some of what Mary Ann has said, but it's a serious matter. And again, it's something that there's been a fair amount of discussion in the community during the time that this has been pending. So it's worth talking about before voting on this and proceeding. All people categorized as municipal employees, special or not, are subject to the conflict of interest laws of the Commonwealth, which are substantive and complicated and are intended to be enforced and cover and to encourage the confidence of the public in the work that's being done for them. But those laws and a classic example is that no one can hold two town government jobs at the same time without it going through a tremendous amount of process in order for people to make sure that there's nothing inappropriate about what that is. And that's what a conflict of interest is. You've got to be able to be devoting, if you're a public employee, your best energies to the service of the town and the public that it represents. But of course, we're all citizens of a community, and we all have our own lives and our own aspirations and things that we're trying to accomplish. And Mary Ann addressed some of those things. One of the things that happens in a town is that you have a lot of people who serve as volunteers. And if they were precluded from engaging in a lot of the ordinary activities that citizens can do, whether as business people or because they are town employees, and all these volunteer appointments, paid or not, are employees under the conflict of interest laws. So it would be very hard for anybody who was a staff employee to serve on a volunteer committee, even if they lived in town and had a strong interest in the subject matter as a citizen. So the law recognizes this. The conflict of interest law itself and the State Ethics Commission that supervises this recognizes this, and they create a category called special municipal employees, which have a somewhat lesser degree of obligation in certain respects, not from the main rule that when you're working for the town, you owe a duty of loyalty to the town, but simply from things such as, if you're serving on a volunteer board or committee in the town, you can hold a job for the town in another part of the town government as long as you're not doing anything that's under the supervision of your board and you don't use your position on the board to affect your department. Same is true if you're applying for a private permit for something in your neighborhood or for a license from the town for a private business, as long as it doesn't affect the board that you're on. But you need to be categorized as a special, or it comes under that general rule. So that's most of the cases that are covered by this rule. It's complicated with the materials that we all had in our packet as an aid to people who because of some questions have been asked at that point. At the last meeting, at which we voted to defer action on this till tonight, there was I don't know, at least 4 pages of single-spaced explanation from the State Ethics Commission that provides more detail about exactly the specifics and the rationale. I only cite the example that I do because it is the most common one and it's important. So we had talked about this at our last meeting. The information was available to all the members. This is a common set of exemptions that's approved in towns, including comparable towns to Needham all over the Commonwealth. So I think it makes, and we deferred acting on it till tonight. Furthermore, and I think it's ready to go, but furthermore, we're talking about the 7 specific changes adding or subtracting from that list is what this is noticed for tonight. The motion goes beyond those 7 changes and says, let's eliminate the whole list. If you're going to do that, you're affecting the lives literally of hundreds of people who live and work in the town. And there should be a posted public hearing for those people to come in and be heard and to be told about what's been proposed and to have an opportunity about the proposed effect on that of that on them and then we can make an informed decision for the community. So that is another reason the motion itself is an overreach over anything that's in the agenda. But what we have before us is a reasonable set of changes that's been fully vetted, that everybody's had a chance to see. So no, I'm going to vote no on the motion, and then I'll be ready to proceed with the rest of the list if that is.
Thank you, Mr. Matheson. Quickly, Ms. Balachan, I know you have your hand up, and then you can.
I would like to respond to these comments because I do, I hear everything that Dan has said. I have read through all the material. I am very familiar with conflicts of interest law and with these concerns. And I think the fact that we are, this conversation, I did not choose to defer. I said this in our last meeting that this is presenting a problem, which is one of the issues that we have been receiving lots and lots of emails about, is one of the reasons why we need to think about eliminating the special designation, because of the ethics concerns in front of us are putting a big spotlight on this issue. It is not, yes, it is affecting the lives of many citizens, but that means you can do business with the town. You don't need to serve on the board at the same time. I think there needs to be a clear delineation between business and service. And we don't have that currently, which is why we are having state ethics violations being thrown at us right now. And so even the fact, frankly, that we do have a state ethics concern and, our chair is leading this discussion, I think is problematic for the integrity of this conversation. Excuse me, I'm talking. The integrity of this conversation and this vote to have frankly, a biased perspective in the room leading this discussion and this vote is not appropriate in my mind. And second of all, it is a slippery slope if you are saying this particular committee can do it and this one can't, which is exactly what this conversation is. There is no need to serve on a board if you would like to do business with the town. And in the example of the stop sign, there are other people in the neighborhood that can present the case. This is a big town. We have a lot of community members. We should be, and I hope we will be when we get to our goals, be talking about term limits and thinking about how we engage more people as opposed to just thinking about the list that have been participating thus far. So with that, I am well aware of, and I heard what you said, and I am, very able to cast my opinion regarding the situation, particularly in light of the situation we're facing with ethics considerations and concerns by many in our community. I do believe, I hope you will vote to eliminate this categorization. Thank you.
Thanks, Ms. Balachandra. I would just caution you, there's a difference between a violation and an accusation. And as we're clear about, as we are municipal employees, anyone can make an accusation to the State Ethics Commission, and that is, in general terms, it is up to us as members of any board to discuss any questions of ethics with town council and to take their advice on such. But with that, here's what I would like to do. I'd like to come to a vote on this motion and then proceed one way or the other. So all those in favor of Ms. Balachandra's motion, I'll ask Marcus,
No.
Mary Ann,
No.
Dan,
No.
Lakshmi,
Yes.
and the chair votes no. Thank you. Mr. Matthews, just in the sake of time, I already stated that I was going to not participate in number 7. Could we have a motion that would not be inclusive of number 7, just looking at the clock?
Sure. Which page in the packet?
Oh, okay, well, they're
I
not-
had it,
So-
I forgot. Oh,
so
here we
I
go.
would
Got it.
move-
Here we go.
That
All
we
right.
move motions 2, 3, 4, 5, and 6 as presented in the materials of the meeting.
Thanks, Ms. Cooley. Is there a second?
Second, and then I just.
Discussion.
Speak to that. I
Yes.
just want to be clear. These motions are on the agenda packet that's posted on the town's website for tonight and available to those here in the room. And that they involve adding the position of the Council of Economic Advisor, the Needham Council for Arts and Culture, the Needham Unite Against Racism Working Group, the Nuwari Working Group, and the Rail Trail Advisory Committee of Special Municipal Employees, and rescind special municipal employee designations for a group listed under number 6. And for those holding positions on those are rescissions, is that correct?
Yes.
Okay. Under number 6 of a stated list there, and that and that would be the motion.
Thank you. Okay, we have a motion and a second discussion. Marcus?
Yeah, I think I'm acknowledging Lakshmi's point and the accusation, things that have been happening, but also taking into consideration of the many people that are currently serving on these committees and listening to Dan about having a public hearing. I recognize that as we discuss our code of conduct later and what we're going to be doing going forward, to completely eliminate it at this time without having discussion and having people being able to talk about, kind of what they're doing is kind of important when you talk about completely wiping out the whole entire thing. But I do agree, we need to talk about and consider and implement changes that will just have no gray areas about what we should be doing. So I understand all points and all things considered, and we just have to come up with a plan, and we will. I know we're going to talk about that later and how dedicated we are to making those changes, but to completely get rid of everything is a tough pill to swallow at this moment.
Thank you for that. So we come to the vote. Marcus?
Yes.
Mary Ann?
Yes.
Dan?
Yes.
Lakshmi?
No.
And the chair votes yes. Thank you, which brings us to number 7.
I
Place this list.
move that the board vote to place the list of special municipal employees updated in accordance with its prior votes taken during this meeting on file with the town clerk and to deliver a copy to the State Ethics Commission.
Thank you, Mr. Matthews. Is there a second?
Second.
Thank you, Ms. Cooley. Any further discussion?
Can I make just
Yes,
one point?
Mary Ann?
In our goals, we've discussed a couple of other committees that will be taking place in town.
Correct.
So I do note that as these new committees are formed and charged, that we will in fact need to make some other updates in accordance with that, in keeping with this standard. So I just want to flag that for people so that we can have a practice that is keeping this more current on a regular basis and be conscious of this.
Makes complete sense. Okay, we come.
Just a question.
Yes. I'm sorry.
What you just said. So basically what we're saying is that we're on number 7 now, and we're going to do further evaluations and updating before we send it over, or what do you?
No,
Can
we
you
are
just
going to
justify?
put, we are going to put the list on file with the state. But what I will say is we add more committees, they would have an impact to this list. So we should be conscious of it so that we designate people as special municipal employees if they are added in such a way to a list. So that's
Right.
my observation.
Makes complete sense. Thank you. Okay, we come to the vote. Mary Ann,
Yes.
Dan,
Yes.
Lakshmi,
No,
Marcus,
Yes.
and the chair abstains. Thank you. Okay, Kate, next item, open the special town meeting warrant.
Feels like we just finished special town meeting, Mr. Chair. I think we did.
We did.
So the board's role tonight would be to open the warrant for the special town meeting that's currently planned for October 25th, 2021. And just briefly on the articles, we do have potential to settle the fire collective bargaining agreement, which is already expired. So that would be for last year. So I don't know whether we'll be able to recommend that to you, but we included it there in case that could happen. We have open for departments, boards and committees to submit requests to transfer funds from one line item to another. Those are due in 2 weeks, so we don't have those numbers for you. If it turns out that there aren't any, that article could come off. There are both the water and sewer enterprise fund budgets are included. That's because the MWRA assessments are different from those. Actually, they're lower, which is always a nice thing. In some cases and not in others. And then the other is the impact of the NIPIA collective bargaining agreement for the current year. So those are the water and sewer enterprise fund budgets. Again, the one that comes up every fall is to appropriate the transportation improvement fees. These are the fees that come to us by the number of Uber and Lyft rides that there were in the prior year. Significant reduction in the number of Uber and Lyft, as I think it would be no surprise, more than half less. The board discussed the outdoor seating in the summer, and this is something that the planning board will have a public hearing on September 8th. And you see, this is the language that's been noticed, but there may be some minor changes to that text after their public hearing. The Ridge Hill building demolition that we've been talking about, the staff from Building Design and Construction, Finance, and I've been meeting with a couple of representatives from the Finance Committee over the summer and working out the questions that the Finance Committee had in terms of the cost of the project and the scope and why some of the costs were so high.
Right.
We are proposing that the vast majority of the funding, or in terms of articles here, come from warrant articles that are from projects that have been completed. So transferring those funds. I would say again, Mr. Chair, the vote to open the warrant in no way implies the board's support of these articles. That comes at another meeting. The article for appropriating for the Emory Grover, this is the article that the school committee will take up on August 24th. So they have not even voted that, but this is the text. So I wanted to make sure you had that. Article 10 proposal is to appropriate to the Athletic Facility Improvement Fund. The project was well managed and we get very favorable bids so that there's $674,000 remaining in the project. And unfortunately, the only way to put it back in the fund from which it came is to appropriate it back in there. So we would strongly recommend that happen, and then it would be available for other athletic facility and facility adjacent projects in the future. Article 11, the final article that's in the current warrant is the board's discussion on adjusting the number of off-premises licenses for the sale of alcohol to meet the same standard that is set by quota by the state. And finally, Mr. Chair, it's not here because I haven't received it, but I do understand there may be a citizen's petition filed with respect to climate action, and I have seen it. It is under review by the moderator and town council, and I understand it will be filed in the next week or so.
Great. Thank you for that summary. And as you said, yes, some of these articles may drop off, and it sounds definitely like some may be added as we move towards the deadline of September 14th. So is there such a motion to open the warrant for the October 25th, 2021 special town meeting?
So moved.
Is there a second?
Second.
Okay. Any discussion? Yes, Marcus.
And I would just ask, the current proposal has us with the date of October 25th, and I understand that the Board of Health is comfortable having town meeting in this room. If there were to be some change in circumstances, what actually is our timeline if we were to have an outdoor town meeting? I'm just curious.
If you were to have an outdoor town meeting, you'd have to advance based on the weather. I don't think the 25th would be suitable, looking at the long-term forecast. So
Right.
you'd have to advance probably a week. It would compress, again, the mailing time, the presentation times, but I did contact the moderator and ask him to have a meeting to talk about what people are feeling. I didn't speak to the Board of Health, but I spoke to the Director of Health and Human Services and Assistant Director of Public Health, Tiffany. And they felt that with the MERV 13 filters, the air exchanges, honestly, the ability of all those windows to open, the fact that we could potentially, if we were masked, if we had perhaps, for this town meeting, there may be a different setup of the hall in terms of the tables. There could be the balcony available for some people. So there's a lot of ways that they felt very comfortable right now, given the number of events nationally, but also even in Massachusetts that are being held indoors that are larger than 300 people, that there haven't been problems with. I think we'll know this is going to be a very difficult call because either things will get worse in October or they'll get better. The run that we had last year was that it dipped down and then came back at Thanksgiving. And if that happened again, the 0.22% breakthrough rate, this is a Needham event with all Needham residents. It's not people coming in from all over. They were very comfortable with that. So I would say if we're going to make any change right after Labor Day, we'll have to have a regroup and decide that. But it would be everybody's preference to be back here. We have also been exploring locations in other communities that are bigger, but everywhere we're looking, our colleges and all the colleges are saying we don't want people from outside coming into our
From
bubble.
Needham, yeah, those Needhamites, yeah.
More like they want their bubble, we want our bubble.
Sure.
So there really aren't the large venues unless they're big schools. So that's a good question. And
Yeah.
right now we're full steam ahead, but I think town meeting might look different a little this year.
Thank you. Thanks for that. Marcus?
Yeah, and as regards to some of the articles, specifically Article 8, we're going to wait until we possibly have superintendent and members from all the different committees to kind of come in and talk about that before we go on with these warrants. And I know this isn't a finished copy anyway, but that would happen first.
That's absolutely correct.
Yeah,
Yes.
what this is the agenda for town meeting. This is the draft, which we can actually change anytime up until we close it. Although I'm happy to talk about each and every one of these now, we don't actually have to, because this isn't to decide, are we in favor or against them? It's just to set up the agenda so that the public will know what we're talking about. And then before we go to town meeting, this board will individually vote whether or not to take a position and what it will be on each one of these articles.
Correct. Mary Ann?
And I would just note that it's really sort of a standard part of our procedure to go through the warrant articles. If there's a warrant article that we feel we need additional information in, that we would routinely invite folks in, like it's likely that we will have the planning board here, for example, just to talk about the outdoor
Absolutely.
dining changes, to have the school committee here on the Emory Grover changes. That would be something that we would
Yes.
do as a routine matter. But if it's not in the warrant in the first place, it can't happen. So this is kind of our super universe.
Mhm.
And then it's not unusual to see things get pulled if they aren't ready
Mhm.
or for various other reasons.
Yeah.
And I would expect exactly that, Mary Ann, when we close it, we come up with a list of, as we always do, boards and committees we'd like to speak to certain articles to better understand them. So any further discussion? Seeing and hearing none, we come to the vote. Marcus?
Yes.
Mary Ann?
Yes.
Dan?
Yes.
Lakshmi?
Yes.
And the chair votes yes. Thank you.
The
Next
next
item, yep.
Thank you, Mr. Chair, is discussion about the American Rescue Plan funding, which is funding that we're receiving from the federal government. You remember there are two tranches of money, some that's coming to us from the Commonwealth is about 3 million, of which we've received half of it. And the other 6 million, which is being administered by the county. And we actually have a meeting with the county to hear more next week about what they're planning. So we have a whole universe of projects that we've talked about here and that I think they've amounted to more than the money that we have, but we have lots of ideas. I would say that I got a little town meeting here on the suggested motion. The board isn't appropriating the funds. I'd ask you to authorize it or support it.
Sure.
Sorry about that. I was typing the warrant at the same time. So the reason that we're bringing this to you tonight is that we really want to be able to have a sense from the board and start planning for you heard we spent 45 minutes talking about COVID and trying to be ready. We did have a public health nurse, an additional nurse that was not budgeted for the last year, and we'd like to keep that. We had 3 contact tracers, and we're asking to continue 2 of them at this point. And we had a part-time epidemiologist, and the Director of Health and Human Services really has asked us whether we could support for 1 year this additional services of the epidemiologist. The work that you've seen him present time after time with all those charts is really informed, and the dashboards that we do and everything that we're able to present, and then just having the guidance from that epidemiologist has been so helpful. So we are absolutely planning to meet with the stakeholders. We've talked to many people about mental health needs, and you'll note in the memo that we're very much supportive of supporting additional funding for mental health. We just wanted to make sure if the board is, the direction the board wants to go with public health, that we could start the motion rolling. We're working to get a meeting together with the chair and vice chair of the finance committee, and we'll be talking to the finance committee about these appropriations and essentially the larger ones as well. But I wanted to get a sense of the board as to whether we could start moving forward on these.
Great. Thank you. And to me, these make a lot of sense, especially urgent nature of these requests. And I think the ARPA funds would be very much appropriate for that use.
Mr. Chair.
Lakshmi.
Yes, thank you. Just a comment, Kate. This is great. I think actually you might, if there's any way to actually increase the allocation, particularly as the conversation that we had with Tim and the Board of Health about testing funds, or if there could be funds allocated for that as part of your plan for the ARPA funds, I would be very much in favor of increasing this ask.
Thank you. Marianne and then Marcus.
I guess I would say, I hear the request, Lakshmi, but I am hoping that once we get after this allocation, that we'll actually look at all the various things that we've been talking about as possibilities. So we can sort of look at them overall and make some big picture decisions about where the money needs to be allocated as the highest priorities. I'm just going to say, having been on a Maven call with the state DPH today, the request for contact tracers is actually huge because people don't have the resources in place. And with the contact tracing collaborative going away, and now I understand 200 people have been rehired and are restarting again this week. We're actually in a position where lots of people have tested positive and have not been followed up on at all, and no contact tracing. And I think that's really a loss. So I think as a town, it's really helpful for us to get these resources in place as quickly as possible.
Thank you, Marcus.
And I was kind of piggyback off what Marianne said about that. And then knowing that this isn't the set in stone, this isn't it. So we're able to add as we look at more big picture and where more needs are needed. So I just want to follow up with that and agree with that. That's what I was going to bring up.
Great.
Yeah.
Marianne?
I'm sorry, the one thing I would say is the finance committee is very interested in having a discussion with us about what our priorities might be.
Absolutely.
So.
And we're
we
interested
need
as
to-
well.
Yes.
We do need to have that discussion with everybody so we can
Yeah.
advance it for the town. Yeah.
Lakshmi?
Sorry, totally in agreement, Marianne. That I think that's a wonderful idea. And I do think to the extent of getting these people on board, or if we can get our hands on these people as Kate would like, I think that'd be fantastic. So I'm just suggesting if we can allocate even more, that would be lovely. Thank you.
Thank you. Is there a motion? Oh, before we make the motion, it would be fine to say the board vote to authorize the use of?
Authorize, I think.
Okay, fine. Is there a motion
board vote to authorize $210,000 in ARPA funds to support full-time public health nurse, full-time epidemiologist, and 2 part-time contract tracers for 12 months to address the town's ongoing response to the COVID-19 pandemic.
Motion's been made. Is there a second?
Second.
Marcus, any further discussion? Hearing none. Mary Ann?
I'm thinking there was one question that came in from the finance committee that did ask if these costs included benefits.
So the positions that we had existing we were already paying the benefits, and for the full-time epidemiologist, that would increase based on the part-time to full-time status. But those funds would be funded out of the health insurance fund.
Okay, thank you.
Any further discussion? Lakshmi?
Yes.
Dan?
Yes.
Mary Ann?
Yes.
Marcus?
Yes.
And the chair votes yes. Thank you. Town manager, reports.
Thank you, Mr. Chair. I have 4 items for you. The first one has to do with communications. Our second communications forum with Cindy Roy Gonzalez is tomorrow at 6. We're refocusing on the website, which many people have many opinions on, so we'd love to have people come. The link is on the front page of our website, so it's at 6 o'clock tomorrow on Zoom. An exciting feature that we have that we wanted to let you know about is that we have a new system called Pulco for gauging community feedback.
Great.
And so it's a polling system that Pulco is a company that bought the National Citizen Survey, which is the group that does and still will run the town citizen satisfaction survey, but we'll be able to supplement that static paper-based semi-annual satisfaction survey with much more real-time data. And the very interesting thing about it to me was that they have a curated library of proven surveys that we can use, and that they have a team of scientists and who specialize in this kind of work, who develop those surveys, and they can also help us develop custom surveys. So we're going to be starting out with a couple of those sample surveys that have been developed by Pulco and National Citizen Survey. And we'll be moving towards using these much more in the future at the request of the board or of the public. I will say that the way it works is that the people who can respond to the surveys are on a panel, and you get on the panel, and once you're on the panel, you can respond to any survey that comes out, or you can actually opt out. But what it does provide is the survey, which is hosted and not ours, will make sure that the people who are responding are Needham residents who are identifiable, and they keep that information, but it can show us that we're not hearing from a lot of Dedham folks about what should happen in Needham, with all due respect to our neighbors. So we'll just let the board know, and you should expect to see a survey in the next week or so.
Great. Good. Yeah, Marcus?
Quick question. For the samples that you're saying that are gonna, what are those detail? Is that gonna go out to us or to the community? When you say just elaborate on the samples.
The way the panel works is that you have to enroll. So
Right.
there's going to be a lot of marketing on all of our parts to get people to enroll, but we have 2,600 or so on our newsletter, maybe right around there. So that's the first place we're going to start. And then we're going to send it out to all of our networks, and we're going to ask all of our community partners and to get people to sign up for the panel. And then once you're on the panel, you'll get any of the surveys, and you can decide whether to answer them.
All right, great. And then they'll be able to provide feedback in the surveys. Like it's going to be pretty detailed oriented once we get to that point.
So there's different kinds of surveys. Some of them are pulse surveys. It's a 1-question survey, quick. You could do yes or no, and you could get one. Others are, you could do live surveys where you can see in real time how people are answering them. And then others might be just more traditional data gathering, might take 5-10 minutes, and then you have to pull it all together and push it out.
So as far as statistically valid, it would be more for to get a temperature of what's going on, or is there some validity? There's some validity through this company to have.
Without question, yes.
Okay.
I mean, the way the survey development is an art, as a science and an art, right?
Yes,
So
exactly.
when we have done our citizen satisfaction survey, we've relied exclusively on the outside provider, and then we have said things like, we would like to know if people are willing to invest in the pool, and they create the question that we were trying to express. And so they put it in a way, and I think the question was, would you be willing to invest in Rosemary Pool even if it costs a significant amount of money? And
Yes,
actually,
right.
something like 64% of them said yes. So,
Exactly.
so yes, I think we'll find lots of ways to use the data. I think the goal, and I think I've heard this from all 5 of you repeatedly, is to hear from everybody in the
Correct.
community, and we want to hear from lots of different people. We think that with the demographic data that the provider will have, that we can tell whether there's a wide net. Exactly. So that's
Thank
just
you.
one update.
Okay.
Wanted to update the board. This came out in July, right around your last meeting, and I didn't have a chance to let you know, but there was a restaurant revitalization fund grant program from the federal government. And we had a number of restaurants in Needham that got funding: the Subway, Spiga, Panella's Market, Latina, Fuji, Capella. But the most interesting to us was Baker's Best received a $5 million grant from that restaurant rescue fund. So that's great. That's a Needham business, and we'd love them to succeed. So I thought that was fascinating.
Yeah, that is.
Also this summer, the Health and Human Services Department has been working to get a new grant to fund the substance abuse program that we run in conjunction with our neighbors. This is not the one that we run locally from that we used to get federal funds for. So they got a grant of $125,000 a year for 2 years with 3 renewal options. So this is a big grant that they got, and that's just their core mission to reduce substance use in our young population. So if anybody can get a grant, it's HHS and Tim McDonald in particular. So. And finally, Mr. Chair, just a few updates on the status of police responses to some of the community feedback that we've received. And the chief will be coming in October, as we said, but there's some things that are happening, and I thought that you would find them of interest. One of the things I think Mary Ann and Marcus will talk about under committee reports, but we do have a planning committee that is working on this notion of community conversations on race. We're hoping to kick that off in the next 2 months, and that will have a policing component, and we've been talking about that. In addition, the chief has met with leaders in the Black community to gain insight and to learn how to the department can work together with that community, and he's working with other groups as well. We are holding a citizen academy, which is a police academy, a police citizens academy in October, COVID willing, because it is an in-person academy. And so information on how people could apply to participate in that program will be out soon. I think it will be it has been done in the past, and people really learned a lot about what it's like to work in the police department. And we can also use it as a way to get our word out and get information from people who go to that training. There was a recommendation that there be additional focus in training on threshold inquiries, and we did do that in an entire in-service training this past spring, and we're going to be doing it again in the fall. So that's training that's happening. Also, the department recently updated the use of force policy to include information that was included in the police reform bill. We had talked about whether we should just wait until the police reform, the post commission issued a model policy, but we felt that it made sense to update that policy and get that disseminated, and I can get you a copy of that. And then if the post commission model policy differs, then we'll update that again. So it's making sure that things that are specifically included in the use of force in the statute were included in that policy. With respect to the dashboard, we've been working to refine the dashboard, and we will be bringing that back to you in October to show you what our newest version looks like. I wanted to note that the embedded clinical social worker has provided services to 83 individuals since December. She's working really hard, and we get referrals from the department itself, from calls, but also from Riverside, from the schools, from parents, families, and individuals themselves. Even from the community at large that are referred to that social worker. So that program, by all counts, so far has been very successful. Again, we mentioned the use of force policy. The policy on follow-up investigations, which is a recommendation from the Tidwell report, has been updated and then will be disseminated to everybody this week. Another recommendation from the Tidwell report was to remind folks and ensure that all of the officers are aware of the policies on courtesy to the public and request for officer identification. So what we've done is we've resent them out to all of the members of the department, providing training, and then have sign off. So that was a recommendation that we make sure people are focused on that policy. Let's see, I think that's the one of the requests that we had was to provide the name, rank, role, and training of all officers on the website, and all of the officers' names, rank, and division are included on the website now under the police department website, and they're considering options of how to report the training that each officer has had. So they're talking about that. One of the other items that you've talked about and others have talked about is the importance of training on mental health. And there's a specific training that we only get limited spots for. So I just wanted you to know that we continue to push. We have 2 officers signed up. It's very competitive, but that we'll continue to do that. So the one mind pledge training. And then, we talked a lot about oversight. The recent internal affairs reports have all been provided to the board for your review and reading, and that we will forward all formal documented complaints that are not resolved at the level of sergeant in the station to the board for review. So there aren't any right now, but we will be forwarding that. So just so people know that internal affairs reports are being read by the board, and you have the opportunity to ask questions or follow up on anything, and that we will be sending you formal complaints that come in that aren't resolved. So the chief will do a much better update, but I know it's an item that's very interest of the community, and we get asked about it a lot. So I wanted you to know that they're spending a lot of time. The one more that I didn't mention is that we have posted a position for an administrative analyst, which is going to help us gather and report data on a much timely basis. Will help us with the reports and the annual reports, and potentially evaluating whether accreditation is something that the department can support. So that is my report.
Great. Thank you so much. And I know we'll have further discussion as we move forward on those subjects. So thank you. Next item on the agenda, board goal setting. So just to set the table a little bit, this is not a public hearing this evening, but what it is we had a meeting the end of July, our typical annual goals meeting. And we went through our list of goals that's available in our packet, and I will highlight some of those this evening. And we considered those and reached consensus on them that appear here. Some of them we removed. It was quite a robust discussion. I think it went from 8 to noon. And unfortunately, we were not able to get to the second part, which is the items for consideration that's dated here, August 17th, 2021. So we will be discussing those this evening. I did want to highlight, and the board can feel free if they want to highlight a couple of these items as well. But for example, we discussed about that's in the warrant, the Ridge Hill building demolition, Ridge Hill and Nike, what we're going to do with that property, Planning Board Affordable House Study Committee, which we're going to be looking at members of this board to be on that committee. And of course, that is a priority, I know, of the planning board and this board to talk about affordable housing. So that's some heavy lifting with that. There was some discussion on public litter, household trash, of course, COVID-19, which again, we heard tonight, we still remains and is going to take up, as it did last year, staff time and resources in this upcoming year. School administration building, we touched on this evening and how we're going to move forward with that, and the school master plan and the discussion on Pollard and Mitchell as well. ARPA was in there, figuring how we're going to use that money, and that would include small businesses, that would include public health, infrastructure, other potential uses, including solar, that we're going to be considering utilizing that money. Of course, going to town meeting with outside seating and how we're going to develop those regulations. parking needs now have changed because of the pandemic. So it's something we need to evaluate as we move forward. And that includes also as we look at transportation needs. We have the Transportation Committee talking about rail. We have TMAC that talks about neighborhoods. And the idea is to come up with a committee or discussion with these committees on moving forward with these initiatives. A big one is the quiet zone, funding for noise reduction, quiet zone feasibility and design. That was discussed at our meeting and voted to move forward to see if there is a way to have a quiet zone in Needham. And that ties in with the rail corridor we have between Dover and Newton. If there's a use for that, that's non-heavy rail. We talked about mental and behavior health needs. We just heard some information on that. And of course, the diversity issues that we've discussed all year, diversity, equity, inclusion, how we get people to engage in the community, and how we have Nuwari moving forward in their recommendations, which again is a heavy lift. A lot, you know, I say these kind of quickly as bullet points, but all of these points have a lot behind them that needs to be done in order to make substantial change and not just a cursory look at these items. So we talked about vision for Nuwari and how we get people to adopt it. The biannual survey, and we just talked a little bit tonight about how we can get input from citizens in a better way. I will say, as an aside, I am very interested, along with the survey, if there is a way to get, you know, forum with citizens to come in and hear what they would like as we move towards goals in the future, what their goals are, I think is very important, and maybe some type of forum is in order to do that. So that would be on my list. But we talked about the discrimination complaint process, and again, ARPA for health and law enforcement. We just talked about, of course, that's something we're going to actively monitor as we move forward. It's a general goal that we had to meet regularly with other boards and committees and look at different ways for these committees to have hybrid meetings if requested. We've talked about the goal of increasing liquor licenses. That's something that we're looking to go to a town meeting to see if we can address. We talked about a orientation package, and tonight we talked about a code of conduct policy manual. That's also important and an important goal for this board to move forward with. And the website was also discussed, as we are going to have meetings on that to get that into the 21st century. Sorry. Develop a climate action plan, 7.1. So that's something, again, a heavy lift for members of this board who will be selected. And I think, you know, Mary and I have had some discussion on the chair, vice chair level to see which members will be interested in some of these committees. And we're looking for a partial acquisition that has to comply with some recreational component in order to put the inventory back to where it should be. So those were the bulk of the 4-hour discussion that we had. Some of these that you did not make it on the list that I just read, that some of our ideas, but this was a consensus document. And then we moved into these items for consideration, which was at the end of our meeting, and we did not have time to hear them. We tried to postpone the discussion to another time, and due to some scheduling and also the technology not available, we postponed it to tonight to have this discussion. So that is where we are. I think with that, I would like to go over our items for consideration and start with number 1, which would be the extension of the community farm lease. We have been approached by the community farm in the past to see if there was a way to expand their footprint or do something different with that property. I know others might have more information on that than I do, but I know it's to have a discussion of the extension of that lease. Mr. Matthews?
I just wanted to.
Mr. Matthews, then Ms. Balachandra, yep.
I wanted to just kind of step back a
Sure.
little bit just to make sure, because we're few folks in attendance and some watching about where we are in the process. And your summary is excellent. But all we have posted on the agenda packet on the web for those that are following the documents are both the consensus list that was developed largely working from carryover goals from prior years that need to be completed or are objects of continuing work, plus some key additional, including the quiet zone and the climate action plan, and others that are in that draft. And then there is a list of 17 possible additional items, the first of which you've mentioned, the community farm, extending the community farm lease. And that our goal this evening, as I understand it, is to go through this 17, decide which to add to the list of approximately 45 that we had gone through, done in the first session, and then reduce that to a final vote to set the goals for this cycle this evening. A long process, but at least, and we have some folks that are here in attendance, and as you said, this is a public meeting, but not a public hearing. So the reason for that is there are plenty of opinions at the table. If we're able to work these all out, that's good, but there are plenty of people who have written into us or called or commented to each of us. And the good news for all of those folks is this is going to happen again next year. And to me, there's two things that happen in this. One is to collect ideas to work on, and the second is to try to narrow it down to what we really can think we can get done in a year. And that narrowing down is perhaps the hard part in certain respect. But do you want me to speak to number one?
Yeah, if you could, I just want to kind of echo what you're saying. You know, I commented at the prior meeting that we have limited bandwidth. And when we put these things on our goals, it's not a cursory, oh, we're going to get to it. It's really a full-fledged effort to get that business item done. And there are many ideas out there that people want to see on it. And it's our job to look at those ideas and rank them and cull them or triage them and say, you know what, this is a good idea, but right now we don't have the bandwidth or capacity, especially with COVID and coming out of COVID. So the idea was to try to come up with ideas that really met that top threshold that we could actually move forward with and had the bandwidth to do. And my suggestion was to really make sure that it meets that threshold before we add it to a list that town staff is really almost at capacity with taking care of. So it's not to say we're not going to talk and consider all of those things. It was pretty much where I wanted to be as when we set the table on the threshold we would need in order to move forward. But Mr. Matthews and then Ms. Balachandra.
Yeah, and then maybe if I could.
Yep.
If there's anyone else who has some general comments, because we've got this list of 17 specific
Sure, why don't I
items.
open up for general, but Ms. Balachandra, do you have a general comment or number one?
No, I thought we were diving into the list. I just wanted to make a comment about the farm. So.
Okay, great. Yes,
Okay.
you will be recognized. Any general comments?
Just the farm. I'll talk.
Okay.
Okay, I think that the community farm is a group that it's a locally based group with a lot of people involved. They put a lot of work into what they do. This though, to me, and there's another one later there that affect this, the community farm is basically is a existing short-term lease, mainly short-term because of the uncertainty about planning for the Nike and Ridge Hill properties that we've had for a great many years. And in fact, when they first started, it was thought that it was only going to be for a year or two before the town decided what it was going to do with property, and then we would sort that out. I'm pretty sure that was at least a decade ago now. So it's a program with a lot of it that I expect is going to be a presence at the Nike Ridge Hill property for many years to come, as long as the interest is there, and that shows no sign of flagging. However, it's one of a couple of suggestions in this list of 17 affecting the Nike Ridge Hill properties, which are mostly conservation land, but include 21 acres of use of property that the town could use for any one of a number of active uses that have no final decisions have been been made about. And one of the goals that we have set in that 45, and I'd say specifically at section 1.2 in the, is to have an assessment of where we are now in terms of all of the studies, all of the planning, all of the suggestions, and including a public, and in our discussion, we talked about having a public forum where people from all parts of the community, including other groups that have expressed an interest in the site, could come in and be heard. So I would not want to include extension of extension means in addition, adding additional years to the current lease. I'm more thinking along the line that until we've had the public fully an opportunity to be fully informed of the studies that we've done, of the different requests and proposals that have been offered, of the different options that the consultants have offered. I think for me, I'm looking for two things there. One is, I mentioned the 21 acres of active use land. They're actually in two parts of the property and separated among over 200 acres of conservation property. And you're not able to move equipment or vehicles between them without leaving the property entirely. And because there's a one-way street out there, it's literally a mile away. We've talked, one of the studies that was done showed options for building an interior road access between those two sections that would be a help to whatever ultimate users are decided to be out there. So those would be my reservation about committing not only the community farm, but any of the other active uses that are already out there. There's a dog park. We have a contract with the community theater where they store some equipment out there. Whenever you're planning for the use of a piece of property, you had to consider all of the existing uses. And rather than create any additional or expanded uses, I'd rather wait till we come up with an answer of what to do about internal road access, which might be nothing. But if we decide to, we should be able to build that without having, based on the decisions of this board, the Conservation Commission and town meeting, and then have a community public forum in which we and make sure that people understand what the conditions are out there, what some of the options are, what some of the things that have been suggested have been, and hear from them as well. So I would rather not include anything about Nike and Ridge Hill other than what's already in the draft guide.
Understood. Your position's clear. Thank you. Lakshmi?
Thank you, Matt. I think there is a growing interest in the farm, and recognizing the land studies and all the things that Dan just mentioned aside, I would propose that we incorporate the interest of the farm to expand and to see how there might be a ways to do it, because I have heard from numerous people of how much they appreciate the farm and what it provides for the community. And if there's a way to carve out, considering that we are moving forward with the demolition of the building, to think about how the farm, which is already there, might be able to access, and grow in the ways that they're thinking about. So I don't know if just limiting it to expansion is the right wording here, but thinking about how to incorporate the needs and the growth for the farm would be my preference.
Thank you. And I think that is something that we would be able to do on that Ridge Hill Nike study as part, I think, as Mr. Matthews, as a larger plan. Kate, is there anything specific on the time of this, or what's the actual request?
So I think that the issue with the farm is that they're at a point where the financial model is going to be difficult for them if they don't have the ability to have a longer time horizon in order to make certain investments in construction. So I think perhaps the answer, I was going to say perhaps we could meet with the farm in addition and give you some additional recommendations, which we'll do. But also including, and I think we would have planned this anyway, including the farm and the theater and the neighbors in the committee that I believe the board has agreed to establish. I do think the conversation about the road will probably be a long conversation, the roadway or the path, and that there should be a decision at some point by this board whether the farm is a use that you want to
Right.
keep out there. You know, it is an amazing operation, and they are feeding a lot of people in town. And so not advocating for the farm, but it is, I think it has a point where we do have an active lease with them, but it's a year by year. And at some point, we should give them guidance as to how long, you know, their time horizon could be. So I think having them at the table at that committee is probably the best idea at this point.
I think it makes a lot of sense to have them come in, explain, and then trying to work with them and see if it is something as far as a long-term plan that we have. I'd be interested in hearing them advocate what they really want before. But I understand that we have to think of them in the master plan. But first, I'd like a short-term discussion on what they actually intend to do and what they need. Mary Ann?
So Kate won't advocate for the farm, but I will advocate for the farm
I
in
will.
this case, because I do agree that the funding mechanism that they use right now needs something long-term. And so I think getting to a decision that says that we either support them remaining in place or that there will be a requirement to move sooner rather than later is actually getting to a critical decision point for the farm. And I also agree that I also believe that the discussion about a road is a much longer term conversation with many more stakeholders. So to the extent that we could gain an understanding and make a decision for the farm, that would be a priority for me. And I would support that. I do think that it's a resource for the community that the community appreciates having and wishes to see sustained.
Thank you. Marcus?
So I think in agreeing with Lakshmi and Mary Ann, but maybe rephrasing this number one, so it kind of states what we are intending to do as far as extended. We want to kind of reevaluate and include them at the table and letting them know, you know, where they fit in our long-term goals. But I know you're talking about short-term. In the end, there's a lot of us that are in agreement that the community, the farm has a lot of value to our town and that we want to see it here and try to work with them in order to maintain that.
So something reevaluating the community farm, lease short-term, long-term.
Mary
Mary Ann? sorry.
I guess I would have asked Kate, is it possible to rewrite our Ridge Hill goal so that it acknowledged this as a piece of it with a need for a decision perhaps sooner rather than later
So part of the goal would be, you know, planning towards a decision on the future of the farm.
on the future of the farm? Yes.
Dan, are you okay with that?
Yeah, I see the farm being a long-term presence out at Ridge Nike. And I guess my main thing is when I've had discussions with people in the community, there's very little information about how that space is structured, what the rules are, what the studies have been, what the issues are. And I guess I want to be cautious about making long-term commitments, which have a way of becoming permanent commitments of property interests before people have had a chance to fully digest that. But I understand the other thing, that they're running a business that's a lot more than a 1 year at a time hobby at this point. They need some certainty. So I'm okay with that as long as it's a discussion that includes the whole community.
Okay, I think that's
So I would
fair.
add it to 1.2, which is begin the original Nike assessment.
Yes, I think that would be smart. And I understand you don't want to preclude any future use, but I think let's bring them to the table and I look forward to that discussion. Number 2, explore access to bathrooms at playgrounds and fields. Who wishes to speak to this? And just for the viewing public, some of these goals are, you know, a member brings, and it's really their goal to discuss because they have more information than others. And some of these goals are a collaboration of our discussions we've had throughout the year that make it on this list. But explore access to bathrooms at playgrounds and fields.
I would like to speak to this.
Yes,
Mr.
please,
Chairman.
Lakshmi.
Thank
Great.
you. So as you all know, I did conduct a survey using, basically lists that I had and put it on the Facebook and et cetera. And this is a big issue in our town. We don't have public restrooms at the fields and facilities. And, parents have had to rely on, unfortunately, like asking the why or going to the local businesses. And this simply is a need. It's a hygiene need. It's a public, safety need. And the Park and Rec department has already started putting porta potties at some of the fields, which is great. They're carving out of their budget, but we really need to have this implemented quickly. I mean, we're traveling now with my kids' baseball team, and frankly, every other town has facilities at their fields. It is just unacceptable that we continue beyond this year without having hygiene facilities at our parks, playgrounds, and fields. So I think this is a very, very important and well-demanded resource that needs attention this year immediately.
Thank you, Lakshmi. I just will say as an aside, I did speak with the chair of Park and Rec, and I think when you look at this goal, the number 4, which we'll get to, a skate park and tennis courts, it's something of a broader discussion that they would like to have with us before moving forward. And there was a suggestion that we have a board discussion, full board discussion, which is one of our goals, to meet with boards more frequently. But I think these would be the goals that I'd like to discuss and get their input on before moving in and putting it on our goals. And I understand the intent of them, but just as Mr. Matthews will tell you, we have a decentralized government. Is that how you like to say it? Right. And we need to get the shareholders and the stakeholders at the table, I think, on
Mr.
some
Chair,
of
would
these
you
issues.
add that to 6.1 perhaps, these talking points, which is meet regularly with other boards and committees? You could schedule Park and Rec.
Yes, that would Park and Rec as well, correct.
And perhaps the schools, because I think that some of the fields are at schools.
That would make sense, yep. And I think these issues, I mean, I definitely understand the intent and might be something absolutely worth pursuing. But this, along with the skate park and the tennis courts, I think we should have a discussion before moving forward. Lakshmi and then Marcus?
I actually think these are separate issues. Bathrooms are not, these large scale building projects like a skate park or even renovations to fields or tennis courts. Bathrooms are more immediate. And I think it's a separate line item. And I think this needs to be a concern for us as a select board, that we then make sure to fund for Park and Rec as opposed to it coming from Park and Rec. So there's just a distinction in my mind that I hope you will all see.
No, understood. We just also have to realize that these parks are under the jurisdiction, many of them under the jurisdiction of Park and Rec. So in order to do something,
gotcha.
we would need their buy-in. But Marcus?
Yeah, I was just going to kind of agree with that as far as priorities. So the skate park and the tennis courts kind of fall a little bit below the bathroom. So I was going to say that and agree with Lakshmi. But agree with all of us knowing we have to meet with other committees and our decentralized government.
Well, the starting point is for us to talk to the Park and Rec
Correct.
Commission. And would it make sense to kind of under 6, I don't know if this under 6.1 or to call or under 6.1A to specifically call out to have a meeting with Park and Rec Commission to talk about matters of joint concern. And then that would be, we've talked about 3 items and Lakshmi has named one that's the bathrooms issue as the priority. But while we're there, we might as well talk about all 3 as well as the concerns that they have for us, as well as they may want to report to us what their planning and issues are in regard to that or other matters. So
I think if we enumerate those,
specifically in the goals, call it specifically meeting with Park and Rec, because we do want to meet with everybody, but we don't always get around to it.
and maybe in that, like you said, and then we enumerate in that, meet with Park and Rec to discuss, and then we could put those 3: bathroom playgrounds at fields, skate park, and tennis courts. So that way it's on our goals, but we also acknowledge that we have to meet with them in order to proceed and come up with a plan. Does that work?
Sorry, one more
Lakshmi and then
addition.
Marianne? I'm sorry.
One more addition, Matt, thank you, is also just the general plan. So the Park and Rec has already done a review of the playgrounds in town, and many of them are either in fair or poor condition, and there's a lot of injuries and things that are happening at our playgrounds. And some of these, they already have the commission report. So I think we also need to put on there in our discussion with Park and Rec, like what playgrounds need renovations in the short term, or even a phased plan for renovating the playgrounds as part of that discussion. So yes, I think that all sounds great, but I would like to add the playground conversation because the Park and Rec division has already done the study and knows what playgrounds to renovate first.
Sure, I think that's appropriate. Great. Marianne?
So I do think, when it comes to the playgrounds, that's work that I believe they've already undertaken. All right. And so it's a question of our being informed about that. And they've had to make decisions and choices with how they're spending their money. And so then it gets to be a question of, again, what's the big picture and what are we allocating dollars to and how does that function? I think when we look at our goals overall, we look at goals that either we, the select board, take leadership on, in which case they end up in our goals. We have goals that are in here because another board has determined that they're a priority. They'll need to go to town meeting. We have to support it at town meeting in providing our opinion or guidance to the town so they get collected here. And I do agree with the approach that says, we do need to meet with other boards and committees to discuss matters of collective interest. We've done that previously with the planning board. I suspect there's a couple more things here that might have planning board discussions where we'll meet, and then they actually are the prime leader on those particular items, and we are a supporting actor. But
Great.
yes,
I think that makes sense. Okay. Number 3, explore zoning. Good segue, Marianne. Explore zoning to allow brewery, pub uses. I've heard that people discuss the idea of having a brewery or brew pub in Needham. Right now, our zoning does not allow it in any zone. And I think it personally would be a benefit to the town to have that type of use and outdoor, indoor activity that might go along with it. But of course, it would have to be set up in the right area and regulated. And there would then be a discussion with the planning board if we would like to move forward with that initiative. So feedback on speaking with the planning board about brewery, brew pub uses as part of our summit discussions.
I think it doesn't do it. I don't know of any specific entity that wants to come and do your business here now. So we're talking conceptually. Am I correct?
Correct.
Yeah, I think it makes sense to talk to the planners.
So is that 6.1B,
Great.
Yeah,
B,
planning board?
Planning
yeah.
board.
Number 1 is brew pub.
And I'm sure we got a lot of other things to talk to them too when
Oh, we
we get
do.
together.
Yeah,
I think
Matt,
all,
a question for you
Yes.
though. I mean, this sounds great, especially for that area where I'm totally blanking on the name, but to think about, so this then is a question of getting the zoning approval, right? Like to get that in place. So
Correct.
that, right, okay.
Yeah,
That-
it would
that
be a
seems-
discussion, exactly. I'm sorry, it's hard to, I don't mean to interrupt. It would just be a discussion with the planning board, whether or not to move forward with some type of zoning amendment that would then come before town meeting, if it followed the right track for approval to allow this use in a zone
Right,
TBD.
right. Or
We might have
it could
ideas
be-
where it would be.
Right, the Needham Crossing, is that what that area
The
is
Needham
called?
Crossing, yeah, that's one
Right.
of them, yep.
Yeah,
Bucksford
okay,
Street, yeah, there's
great.
another, yeah,
Okay, thank you.
great. Skate park, I think we discussed. 5, consider a memorial acknowledging the history of slavery in Needham. Who wishes to discuss that, or where the genesis of that?
So,
Yes.
yeah,
Marcus.
so of the Human Rights Committee, I believe we had 2 young people that kind of came on and explained to us the importance of acknowledging, slavery, enslaved people that kind of help, in essence, build this town. And some of it has to do with one of our churches. I don't know all of the details, but when I consider where we are and what we haven't done as a whole for many years, the acknowledgement of enslaved people that have helped build and bring our town to kind of where we are right now is something that I find really important and really valuable. I think kind of deep diving and seeing where, when, and how we can get this done is something that the community can really benefit from, and kind of learning more about ancestors and people that kind of did the work to make it, make a lot of people able to profit and to sustain their longevity and their livelihoods, and never being recognized for the work that they've done is something that is long overdue. So I definitely something I would be for.
Further discuss? Yeah, Lakshmi?
Yes, can I add to that as well? I'm also very much in favor. There's been a lot of people who have reached out about this issue, and I believe the Needham Public Library had a seminar about, slavery and enslaved people in our town, which was way oversubscribed. People were not able to attend. There is a lot of interest from our community in acknowledging this in our community. So I also agree with Marcus. I think it's appropriate and timely, and there's been a lot of demand.
Thank you. Further discussion?
I have a question.
Sure.
As we talk through all of these, I do think about how do they fit within our bandwidth?
Right.
And who is going to be taking it on? And to me, there's a difference between acknowledging the history and having a memorial to it. I think every town around here could have a memorial. We could, so I don't mean to make the issue smaller in any way. I just am not clear whether we have appropriate understanding to move directly to consider a memorial acknowledging the history, or whether in fact the understanding of the history becomes more of our community conversations. I just wonder if there's other avenues for thinking about this. It's not clear to me that moving to a memorial is the right way. So I just observe that.
Okay.
What,
Dan?
yeah, what if we have in the goals a number of goals that are related to work on race equity and justice, and continuing work of the Nawari Committee during the next year. And I know the discussions that Lakshmi has mentioned, I followed them and read some of the Historic Society had done some work. What if we kind of, is Nawari a group that can fold this into its work in the next year and think, because when I first saw this come to us, it wasn't just about slavery, it was referring to indigenous peoples and there are a lot of different ways that you might proceed. I'm not saying, I'm speaking, monuments are really not my thing. I'm more about the problems that we're working on now, but I guess I'm hearing what Mary Ann says. If I'm gonna have a monument, I'd like to see it done the right way. And it's just something that Nawari could kind of think of within its scope, and maybe we'll talk about. I think that in the long run, it would be a good thing to do, but I'm not sure exactly the form or the right path. Does that help?
I think in some capacity it does, but consider maybe changing the wording and consider maybe the gathering of more information on how to do this in a way that we can. I'm trying to say how to word this because I'm just thinking out loud, as far as whether it's a plaque, whether it's we have a day where we acknowledge the certain aspects of certain enslaved people that help do certain things in this town, or what exactly we're going to do. But I think considering this next step is going to be important. It may not be a memorial right now, but it could be us working towards that. Does that make sense?
So
Acknowledgement.
considering the
Yeah.
best, the appropriate way to acknowledge.
I think we need more
Acknowledge the
information.
history
Yeah.
of slavery in Needham.
So
Could
I
the
think
HRC
it's-
do that? Or is that?
So two young kids presented to the HRC.
Okay.
And
Yeah.
as far as what the HRC can do, as far as their capacity, which we'll talk about a little bit later, as far as what they can do with that information and how, that can be used to determine what happens next. I think that's gonna kind of come with evaluating the role of HRC. But
Okay.
Yes, I think Lakshmi had some.
Yeah, Lakshmi and then Marianne?
Yeah, thanks, Marcus, for adding that, because I think it is under our purview, right, to make this happen, whatever memorial or whatever we want to do. So maybe we need to understand what people would like to see happen, but that we are working towards the creation of a memorial, because that's what I've been hearing, personally been hearing from people in town, that is something of interest and of need. And as I mentioned, the overwhelming interest in this topic, given the community currently. But the other thing, and I did, Marianne's comment that other towns, aren't doing this. I don't think that's a reason for us not to do it. I think that's in fact more of a motivation for us to do something and to show our interest in this topic and where Needham is today. So thanks.
Thank you, Marianne.
So I do just want to clarify, I did not say that other towns are not doing this and therefore we shouldn't have any interest. My observation was that every town around this has the same conditions that Needham does largely in their history. And, back to Dan's point, I chuckled. I think most of the early slaves likely were indigenous people, in fact. So, it does all come together from that perspective. I think whether this were to be something that went within the role of HRC to consider and think about what options might be for acknowledging in some way, shape or form, or whether it went to Nuwari. I think HRC would actually be a great group, but I know they're very focused right now on the complaint process. So I think that would be again, a discussion we'd need to have with them to figure out if it could fit there, or whether it might be something that Nuwari would take up. HRC would be my preference, I think, as a committee focused in that area.
And I just think that's important. I know, what was it, a couple of years ago, Kate started assigning people to these things, like leaders of these, because there's so many ideas, like, okay, who's actually going to take this on? It's nice. So I think it's really important as we move forward to assign this to a group, because we talked about bandwidth and then you don't know who's taking the lead on it. So if it is HRC, Nuwari, something that we should consider. But I think in the meantime, I think the acknowledgement of slavery in Needham is a first step and the best way to acknowledge that.
Sure, I will gather information on the appropriate acknowledgement of slavery in Needham. Is that a goal?
Is that, I want to make sure that everyone, yep.
And then you can decide
Then
who
we
to
can decide
assign
how.
it to.
Sure. Okay, consider tree preservation strategies. Marianne?
So I think this was the one, there was discussion, there had been discussion about a tree bylaw. And so then the question is, do we think about tree preservations? Do we think about tree bylaw? Somehow the tree bylaw started with an original group of people. Some of the people who were involved are no longer involved. It's not clear whether it petered out or what, but there's definitely concern about trees. I think there's in many cases a lack of understanding about the role that trees play, particularly in relationship to some of our stormwater issues and the benefit that they might play there. So it's an interrelationship. To me, this is still a priority that we need to figure out how to bring forward. It is something that requires joint work between our board and the planning board. And I think it also has interrelationship with stormwater, which I think is just within our board. Is that correct, Kate?
Well, yes, but the opinions of the Conservation Commission are.
The Concom. So yeah, a complicated one. But I would like to see us find a way to work on this, and would be willing to talk about that one.
Okay. Marcus?
Would this be at all rolled into our climate change committee or the committee that we're forming in some capacity, or is this completely separate? Because I can see possibly, but obviously there's a lot more players at the table when you think about all the different people that have to be involved in it, but I wasn't sure.
So here, I guess my observation, I've been thinking about this climate action committee for a while. It's going to need to spend the next couple of years at a very high level, big picture, which means it's not getting to the detail of this tree preservation or tree bylaw.
So I would still propose that this gets broken off separately.
Yeah, just wanted to bring it up because I do.
Yeah. It's gonna, the climate action group is gonna need to understand the macro level of where all the energy is going and coming from in the town, and how we start, where we can apply the dollars most effectively to reducing our carbon footprint. It's a different question that's before it first.
Okay. And so that would be,
Sorry,
yes, I'm sorry, Lakshmi, yep.
sorry, one last comment, Matt. Mary Ann, this is, I think is completely right here, where I think the tree conversation is more around the development, right? And the rules around what trees are, you know, can be cut down for sake of development. Well, like, so it's more like tree preservation as opposed to climate necessarily. So I don't know if this is a question that goes more for zoning or planning. Is that where the conversation could also be directed, or if it comes under our umbrella? But I think it is, just as you're saying, like a conversation that seems a little overdue. And so I don't know. I don't know where to go with that, but I'm just putting that on the table.
Right. So this could come under a zoning bylaw relief, could come under some type of regulation. I think to start, we talked about meeting with the planning board, and we'll see if we're in agreement though. Would we have a joint meeting with the planning board and then break off from that and try to reconstitute some type of committee that can look again at strategies? And then also, I think Mariana, she points out the drainage issue and the effect that it has on stormwater runoff. So I would support that. Dan?
Yeah, I think calling it out as a separate item, there's some work for us to do, which would be, it does, as Lakshmi said, it mostly arises with clear cases of clear cutting or near clear cutting of lots for redevelopment, when there's redevelopment. That's when we hear about it the most. And there are at least a couple of comparable communities in our area that have bylaws that set up systems that limit that, or that assess basically additional permit fees to developers that want to remove trees and that are in the large trees that are in the setback area. And I think a first step is to get copies of those bylaws. And then one of the things that, as far as I've seen, they involve is the select board ends up with the authority to set what the fees are, which are substantial in some cases. I do think though that the core of the thing is a zoning bylaw that says if you're going to get a building permit involves redevelopment, just as with many other things. You had to, for example, now you have to have a storm drainage plan, or you would have to have a tree plan too. And so, yes, I would think include that in a meeting with the planning board, but I think that there is some independent research for us to do.
Marianne?
I think there has been prior work that actually has assembled a lot of that.
And that would be
data.
good. Maybe we
Correct.
get that.
Yep.
We can get that. All right.
So we're keeping this under as a goal,
We're keeping this, but putting it under meet with planning board.
both? Because I'm trying to
Either way, what do you
differentiate
think?
because this one really is yours.
Okay.
I think that
Okay.
as opposed to like bathrooms at the park and rec
Okay.
fields, which are under their jurisdiction, I do think this
So
Because
we-
we own
yeah.
all the fees and the
stormwater.
stormwater. All right.
So we can keep it as a goal, but I would like to meet with the planning board because I
Yes.
know they have a lot of interest in this.
Put it in both places.
So, sorry, just one
yes, I'm sorry.
clarification. So I guess this question is for Dan. So Dan, would you envision this being like a fine situation? Is that what the,
It looks like a fine, except it's a fine that you pay ahead of time. If you look at the Wellesley bylaw, which one of our constituents sent us, it basically says you have to maintain all trees over a certain, I think, 6-inch caliper that are in the side and front setbacks, unless you have a demonstrated need to take them down, in which case you pay. And the charges are
are
significant number of dollars, and they're set by the select board.
Yeah, that makes sense to me, and especially if Mary Ann's saying with the stormwater consideration. So I think there's a good water justification as well. So, yeah.
And the idea is that that goes into a fund, those fines, and that they're used to either replant or some type of mitigation where it comes to trees, and that could be stormwater.
It's not a fine, though.
Yeah.
It's a fee. And
It's a fee.
because you're voluntarily paying it as part of getting your building.
Right.
permit.
That's right. It's a permit fee. That makes sense.
Right. Okay, evaluate the role of the Human Rights Committee. Marcus, did you want to speak to that, or?
The role of the HRC.
So I think that's, it's definitely a complicated, I feel, discussion. For being on the HRC and kind of talking with other constituents, and our chair and the rest of the members, it just feels like, because of the way that we're written into the chapter, it feels that sometimes they're a little bit more constrained with what we can do, how we can help, and the action that we're given as far as to respond to things that happen in the town without the kind of process of contacting the select board or waiting to hear back and then setting up this and getting it proofread. With, the people and the members on the HRC, these are people that are so highly involved in the Human Rights Committee of Needham and different situations that come abreast that we feel like we're able to, handle within the moment. And sometimes it feels like the severity of a certain action kind of gets lost in the process, taking, a couple of days instead of acting as soon as something were to happen. And I think that's some of the case that we saw in some of the tragedies and murders and things that have happened over the past couple of years. So I think using the expertise that is assembled, that we've appointed to that board, and really using it and trusting them to make statements or to help with certain areas without having to come back to the select board to wait for approval or sitting in front of the select board to get approval on certain things is kind of one of the things that we have talked about, kind of evaluating to see if anything can change with that. And I know that's just one thing, but I think that's the one that kind of came up the most in the meetings that I was a part of. And I don't know if Katie King is able to speak more to that because she was a part of those, or just, I don't mean to put you on the spot, but I know that you were a part of those. Okay.
Thanks, Katie. Yes, ma'am.
So I think I had included this here. It's definitely been part of the discussion. One of the things that we have learned is that the complaint process, there was a concern at one point that their involvement in the complaint process would mean or would be facilitated if they had a change in their structure.
Mhm.
And I do believe that what we've learned at this point, that a change in the structure is not required for them to participate in the complaint process or implement that. So that is not it. One of the other things is definitely there's been, as Marcus said, this concern about being able to issue statements. And the thing that I think we've also had discussions with over the last year is that the statements have to be created within the realms of the open meeting law. And the committee actually has to come together to talk about what their intent is in that statement, to draft the statement and to vote the statement as a group. So because it's a committee and because it's required to operate under open meeting law, all of those things have to sort of come together unless they agree to deputize one person to create the statement, in which case it's the statement of that person, not
As
the
opposed to
statement
the
of the
committee.
board. So it gets complicated. And I think we've been sort of working through all those individual issues. I do think it's something that we need to continue to work on with them. And I know that they have, it's been helpful, I think, having Katie be with them regularly. I know that I've been also trying to stay connected to the complaint process, and so it can go in our goals. I think we're going to continue to just kind of work through some things this year. And it's a topic I think that all of us are sensitive to. There has been friction and frustration. And we want the group to be able to be successful for the town on these issues.
And I guess, I know we have developed a discrimination complaint process. I guess, again, in order to have a goal, I'd like to maybe get a better understanding of what they would like to do and say, okay, we would like, how do they want to change? and then we could reevaluate instead of just evaluate the role of them. I just think that's going to end up putting us in circles. But I think we've
Can I add
started it
one
with the
thing?
discrimination complaint process. Lakshmi?
Yeah, sorry, can I add one thing? Because further down in our goal possibilities are the notion that the Human Rights Committee could evolve into a public safety committee, into some sort of conversation or oversight or committee, or, you know, as we think about these complaints and having more authority for this group that does not seem to feel empowered. Maybe that's a way to broaden their role and to have them take a more active part. So I'm just putting that on the table, that there is a suggestion that has been brought to us as a possibility for HRC.
Yes, Marianne.
So I would have said that I do support, Matt, your idea that maybe we go back to the HRC and say, come back with a proposal at this juncture about how you would like to see a change, and then we'll have something to discuss.
Dan?
Yeah, I think, not to brush aside what Lakshmi had said about the things that are farther down, but I don't agree with that suggestion, so I don't want to lean on it in trying to deal with this one where I do. And I think that though I had the advantage or the opportunity, because we started having all of our meetings be on video, to watch some of the discussions of this issue in your meeting, Marianne, with the HRC, and felt that that some of these limiters that Marcus has described, I think, were really, to a certain extent, misunderstandings that we've tried, in the sense of, in terms of the kind of messaging that HRC wanted to do in response to emergencies. Big concerns that I had were really two. One was that the open meeting law be followed, because there were instances of which it wasn't. And we know people are passionate about this stuff, but we really feel that we got to be careful with that, because those laws have a purpose too. And the second is to try to coordinate the messaging of the select board and the HRC on these issues. And that probably involves some more discussion than we should have. And I think that when I see this, but I feel like we've made some progress as a result, over the last year on this. I really saw some real anger at the table in at least one of the meetings that I saw it. I said, wait a minute, this isn't the way this is supposed to be working. I think one of the things I would look to 4.11, and want to be calling out in the goal that the HRC should be involved in the development of the discrimination complaint. I know they are, but we didn't say, it's not said in the goal. And then maybe to try to address what Marcus has said, and Lakshmi as well, in terms, and others, about, we should, again, this is a committee that we need to have a meeting with to kind of clear the air a little, to make sure that we're on the same page on some of this stuff. Because I think that the discrimination process, which we've seen as a mediation, as I understand, a mediation process for things that are of concern, but not likely to reach a litigation or a criminal enforcement level, that those should go to the HRC for resolution. And using the model that we had looked at, which the HRC did most of the homework on, was Arlington's. And I think that's the starting point. So I think that we can bring this goal into a couple of tweaks of the text of 4.11 in terms of involving the HRC in developing the process, and consult with the HRC regarding next steps.
And our door is open, like we talked about, for suggestions on how they want to be more involved in the town at the same time. But I think a meeting with them it's a lot of meetings we're setting up on our calendar, but I think it'll be well worth it at the end of the day to get this FaceTime.
So we're putting that in 4.11 along with the notion of consulting with them on their role.
Yeah.
Is that what you want to do, or do you want to keep it as a goal?
Not put in for, I think in order to understand what their role, what more that they want in a role, they need to have a discussion to bring to us. And when we meet with them, they can say, we'd also like to do A, B, and C. And it might be something we say we're not interested in having that, or we might be something that we say that's a great idea and, we're 100% behind you. But I think it's worth having that discussion.
But to be fair, I
Yeah.
think part of what they learned in the discussion with Arlington is some of the issues that surfaced through this discrimination complaint process led to their next layers of work. So I do think that they're hoping that it will inform
Okay,
their thinking about where their next work will go. So
we talked about the tennis courts, that we can work with that in Park and Rec. Discuss goal-setting process for future years. Build and time to seek input from other boards. I think it's generally a good idea. I don't know about our goals, Marcus.
Yeah, but I don't think what we hit on with the surveys is something that you said as well from other input from other boards, but also with the community and their input by using these surveys and having possibly a public forum. I think maybe we amend it to include that in there as well, because that's going to make a difference. And yeah, the first part of it seems like a no-brainer, but adding that in there, and we've discussed it a couple times, and I think makes sense.
Yes. Settle contracts with employee unions. Isn't that always our fault, Marianne?
these ended up on the additional list. I do think that they should be part, we always work to settle contracts with employee unions, so that's not actually new.
Okay,
And I don't even think we have a goal related to it because it has to happen just as in the course of business. My real purpose here actually probably was number 11,
okay.
which was I wanted something to be in our goals in item 6. Am I at item 6? No, 5.
5.
Where we actually signaled that part of the work that we need to do in this area is, we are still very much looking to understand what alternatives might be available to us with the civil service system, and that we appreciate their partnership with us in trying to understand how we can find a workable solution there. So I just wanted to be explicit that that is, remains a key priority of this board.
I think that makes sense. That's something that we have been discussing for many years. I don't know, 4 or 5 years. And trying to get to that point. Dan?
Yeah, I think I maybe look to the town manager to who does the bargaining of the contracts to give us the right, a best wording for. I think that a statement of principle that the board has a goal of taking our public safety departments out of the civil service system I think it's an important commitment for the board to establish. On the other hand, one piece of that is, under all circumstances, if you exit civil service, you had to replace it with another set of rules. And maybe there's a certain amount of work to be dedicated to figuring out what an optimum set would look like for us. And the question, both about how you phrase the resolution and how far we go down the road towards a new system, is bounded by the fact that under current law, the only way we can a bargaining unit can be taken out of civil services if they've agreed to participate in that process in their contract. So this all starts in collective bargaining. I'm sort of asking this as a question to the town manager, is the best way that this board can phrase that kind of principle and its goals, and at the same time respect the fact that we had to go to the table in good faith and work with our employees over what could be some very contentious issues.
I think I wrote this one, so I think it's fine.
I think, yes, and I think you already have a draft of the replacement anyway, and there's a two-way street working with the police, and both of us benefiting at the end of the day. Evaluate the results of the League of Women Voters study on town government. Is that a goal, or is that just a? Kate, Marion?
So I don't know if at some point we would also like to hear from the league.
Okay.
This was something that's just come out very recently over the summer. It's just, they completed their study and they've just issued the final results. There's a whole range of potential actions that they've suggested. Some to me look easy and obvious, others would definitely take more discussion and more understanding. I think in putting it here, I just wanted us to recognize that the study was done and was completed. It has a variety of recommendations. I think we should learn about them. And we may conclude from those recommendations that some in fact are, fall in the category of low-hanging fruit and are things that we would be easily able to accommodate within our work plan this year. And others are things that will take more study, and I actually don't know where they stand. So maybe this is just another one that goes on our list of groups that we need to have in, we
Yep,
need to
I
meet
think
with,
that-
and then we need to figure out what would be appropriate going.
What their ask is. No, that makes sense. Discussion?
Yeah, I
Lakshmi?
can just add, I can just add to that, just exactly what Mary Ann was saying. They have a whole list of very cogent recommendations that I think would be well worth it for us to delineate what we could incorporate this year. I think some of them are very much low-hanging fruit and would be a very nice thing to quickly, pivot and move on. So I think it would be worth the time. They've done the study. They're a well-respected organization, and that this is their bread and butter. So I would hope that we could put this on the site.
Further discussion? Okay. Here we go, back to Ridge Hill. It's like person will never leave here. Board terms that conclude function auditorium venue. Whose is that, Lakshmi?
I think it might be mine. There's
Okay.
been a lot of discussion, as we've seen, right, about Ridge Hill and its use, and the community farm is there and expanding that, or they provide services for the town, and it seems like a low cost item as well. But there's been also some discussion about that space, and because we are constrained in this, we're not a very big town, but thinking about some of the resources that were lacking, and one of them was a public auditorium, having a theater space, a public, like a theater type venue. I know the skate park people, right? The skating, there's also been that discussion, but this was brought to my attention in terms of an auditorium, a public gathering, or a community center. So because we do have the farm already there, and that is so community minded, so thinking about that space in that way. But I think this goes, as you said, on the list, right, of how do we meet the town's demand.
Right, and I would say that would be incorporated. I know we've looked at multiple uses up there, but how that all blends together would be part of that, assuming the study that we spoke about earlier about Ridge Hill uses.
So the question is that part of 1.2?
Right, and I'd say it would be.
So I'll put in there, just.
Yeah.
I think, couldn't we put it on the list as what to research for this year, or think about direction, because the demolition is going to happen, or assuming that gets approved?
I'm sorry, say that unfortunately your bandwidth's lower. We can hear you though. I just, you're
I
saying
apologize.
put it how?
Put that it could be a priority to investigate what to do.
I think it would be best as part of that overall, instead of piecemeal, the 1.2. And I think we can add, including, including community use space in that area.
One thing I would say is I hope that we can, and I'm the guy that said I don't want to make any commitments up there
Here we
until
are.
we've had a full public process, but 1.2 should be seen as broad enough to include whatever uses
Yes.
the community wants to talk about. The last time we had a full public discussion, as opposed to having hockey players and farmers and crowd into this auditorium and yell at each other, we had a large group of people come in and present at least 15 different options, some which worked well together and some which did not, for possible uses up there. And I'd like to make sure that no options are excluded before we really, we did, for example, a large study through Weston and Sampson about some of the possibilities for what's practical in terms of how you could redevelop portions of that property or use parts of it in an active way that would be respectful of the conservation values that dominate them, that are for the majority of the land. We had that study, but we never even had a full meetings of this board and the Conservation Commission, much less the community stakeholders. Almost nobody has seen those things, even though they're in great detail and they're on our website right now. So I guess I think 1.2 says, let's study this, let the community know what we've done and listen to what they have to say. And then all opinions can come to the table.
Great. Okay, next item, oversight of the police department. I think that was Lakshmi. Okay, we'll circle back to that. Give a minute.
I think all of these items are from Lakshmi, so.
Right, that's what I'm looking at and seeing.
There she is.
Okay.
Here she
Hopefully
comes.
with
You're
They're
back.
back.
Welcome back.
Thank you.
There, you're back.
Sorry.
No,
Bandwidth.
part of technology. Okay, Lakshmi, we're moving into oversight of police department.
Great.
That is your point, I believe. So if you want to discuss.
Sure. I think we really need to think about some of our, I know, and thank you, Kate, by the way, for going through some of the fabulous progress that's happened in terms of our policing processes. But I'm wondering if we can do more, and we do need to make this priority. We do have a lawsuit that we are currently embroiled in this town. So we can think about ways of moving our policing oversight and overview in further. And I think one of those ways we might want to engage a consultant to help us think through what other actions we should be taking.
Okay, and I know there's a very sensitive area and due to the current lawsuit that's pending, and we're very limited on discussion, but you have a general overarching comment here about looking at these, reviewing our policing policies and oversight of the police department, et cetera, creating a citizens advisory committee, which could be the HRC, empower the committee for policy changes, and then disciplinary review. So discussion.
Yeah, I guess it is. It is a sensitive, it's a difficult topic. And one that's, has affected us for the last year, and it's going to affect us for years to come. And it includes the Marvin Henry case, in which an innocent man was wrongfully accused of participating in a shoplifting, and he was held for half an hour on the street, and the fact that he was black was a factor in what happened. And we know, as I said at town meeting, I support our police, and I think they tried to do the right thing under the circumstances, but it's clear that it should have been done better. And but in looking at our goals for the coming year, we've really tried to craft, I think, some material that's that's careful, that tries to deal with the concerns that you've raised, Mr. Chairman, which is really pretty much everything that's in item number 14 follows in one of two categories. One, it relates directly to the specific case or would be affected by the specific facts of the Henry case, which, in spite of the best efforts of the town to try to reach out and to resolve this, that has not happened. We are now the town has been sued and we're in litigation, and what the members of this board or town government can talk about is very limited, and that makes it very limited in terms of talking about anything that we might do based specifically on the facts of that case. The second is that we have not done nothing, and the town has not done nothing in terms of responding to this, taken the matter seriously and the problems that it showed, and tried to move in a responsible way to improve our public safety and to help as part of making this a more welcoming community for everyone who lives, works, or passes through. And that specifically includes, the chief came before us on June 8th and presented a pretty comprehensive list of things that he has done, intends to do, intends to seek to implement. And we've set as a goal to monitor the results of that effort and during the coming year. And I think those two things, the limits on what we can do at this point, and the fact that we have acted within the ability that we do have, hopefully is a pretty substantial work order for the next year. And that doesn't mean there won't be further changes in the future, but I would not seek to incorporate any of the material in item 14 in the goals.
Thank you, Mr. Mann. Just to be clear, I know we're not discussing the Marvin Henry case, but the opinions you have are your own on that case. I think
That's exactly right.
we all have different opinions that we could
That's
probably
exactly
say
right.
and disagree or agree. I will say on 14, the way I look at it, to make these wholesale changes when we are the elected officials in Needham, that I think, the buck stops here. Instead of having an appointed board or committee that answers to us, we answer to the voting public and the public at large. So to me, the role of any oversight should be with this board. And I know there are going to be changes on the state level, et cetera, but I'm not interested in making these changes to the police department and the oversight. But
Can I
Marcus,
just add one thing?
Sure, Lakshmi and then Marcus.
Sorry,
Yep.
just one quick thing. Just to Dan's comment, this is not in response to anything that we have done or to the pending lawsuit. This has actually nothing to do, in fact, with the lawsuit. I think these are all concerns that a lot of our citizens have had. The Marvin Henry case has just honestly, brought a spotlight to some of the concerns that our community members have had. And I'm not sure you can say that those issues have been addressed completely, particularly speaking as a person of color in this town. I'm sure that's representative for you to make that statement. And I do think there is a need to understand, Equal Justice Needham did a report to outline some of the police based on the police reports. This is Needham's data itself, not, we didn't make this up. We got the data from the police record. So this is Needham's data. And I do think there is a need to think about what we can do further, and we can be a leader in this regard when it comes to how we think about policing and what we want to have in our community going forward. So I just want to, state that I do not think, and I disagree that this has anything to do with what the town has done regarding the Marvin Henry lawsuit. This is completely independent. And I think it would be a really good step forward for our community to think about what we can do in terms of updating and bringing forward our we have a great police force, we have a wonderful community, but we need to think about how to bring it into, to be the best in all domains. So thank you.
Thank you for clarifying. Marcus?
Yeah, and I just want to piggyback on that and saying, obviously that this isn't just in retaliation to what's going on with the lawsuit, but I think a big reason why New RE was formed and being a part of that, myself and Mary Ann and Matt, and going through this work and taking the recommendations, very seriously that have been given. And I believe that when it comes to reviewing the policies and procedures and rewriting guidelines and things of that nature, that is something that has been bestowed upon us by what we have wanted New RE to kind of encapsulate and bring back to us as things that we need and want to do in order to get to a point where we are setting a standard, not waiting for one to be set for us. So when I look at some of these, when I look about reviewing in the policies and reviewing bias and things like that, and I know the buck stops with us as it should, but having an extra set of eyes on it, I know other communities have done this and it's been successful, and it's something that maybe we take a look at. But as far as definitely doing something where we're reviewing our policies and really deep diving, along with the work that's already been done with the chief and Kate, is something that should be a priority for us. And I feel like if we aren't making it a priority, especially with some of the recommendations that New RE has given us, then what was the point?
Mary Ann and then Dan.
Okay.
I actually thought it's on our goals because we already recognized that it was a priority. And, to me, reading a bunch of this is already embedded in the work that the chief has laid out, that he is working on, that he's been reporting to us on progress, and that, had been identified by New RE previously. That's why they're on the list that the chief is working on. The one item that's in here is create a citizens advisory committee. And what we have said so far was that the select board at this point was in place to be that committee for reviewing those matters right now until we see what the post commission actually proposes for that disciplinary function. And then we can evaluate what's the right step for Needham. So I think this is a little bit cart before the horse-ish. I mean, there's work that's in process that I think we need to take care of.
Matt, I'd like to speak.
And
Hold on, let it just finish, please.
and
Lakshmi.
then I think we need to see what happens at the state. That has been the question, so that we can say, does that meet our standard? Does it not meet our standard? How are we going to say what the right standard is for Needham relative to that? And I just don't know where that is today. So I think retaining that responsibility at this point for the board until we understand what the other structure is makes sense to me.
I will go to you, Lakshmi, because I know this directly involves you, and then to Dan.
Yeah, thank you so much. I appreciate it. So I would like to say that I think this notion that the select board has been oversight is also misleading, because I mean, we do have a lawsuit on our hands. And so to me, that does signal that there has been some stopgap here, that we cannot say that we have been very good at this as a select board. And so with that in mind, and recognizing that, you have just said that you're just waiting for the police chief to come back. And this is based on a department that may have had some issues that we recognize now. And to then just expect the police chief, which I don't think is really fair to the police chief, honestly, from a management perspective, to have, that individual have to come up with all the answers. So what I'm proposing, what this idea would be, is really to help the police department themselves to understand what changes, should we be making. We're not experts. I mean, none of us in this room are experts in policing or in police reform. And, I think we're asking a lot of our police chief right now that I don't think is really fair. And so by putting in or engaging a consultant to help us understand, all of us, right? Because we're not experts, And because we recognize that there have been some failures, right? We have a lawsuit. I mean, clearly we have had some failures. We acknowledge that this was Marvin Henry does, as again, puts a spotlight on some of our failures in our community that we need to rectify, and we need to make this a priority now. So I think we need some help, and that's what I believe, many of my constituents are asking, that we do this, right? That we try to understand how to fix this. And, I don't think it's fair, again, to ask the police chief to do that. I think it's only appropriate that we all get assistance in this matter immediately.
Okay, thank you. And again, we have a lawsuit. We don't have a judgment or a settlement. We have a lawsuit, an accusation. So that's where we are. Dan?
Yeah, just to be clear, I'm not in any way suggesting that we've reached an end result on changes to law enforcement here in town. We brought in a nationally recognized expert to help us understand the case, the facts of the case that's now in litigation, and to give us suggestions for improvement. That's the Tidwell report. We formed the Nuwari Committee, which some really good people put a lot of work into, and we charged the chief with developing recommendations to implement changes to address concerns and shortcomings that he or the town manager and others working in, and there's been plenty of public criticism and input, as you said, Lakshmi. Drawing on the Nuwari recommendations, the Tidwell report, community input, his own professional background and resources, input from this board and the town manager, the chief developed pretty lengthy list of changes that he either implemented or is seeking to implement in the current year. A number of those are contained within the text of item 14. And I guess what I'm suggesting is not that we're at end result, but we should see how what success and other issues are identified in the work of the coming year, and then we'll have further review and there will be further changes. But right now, we've got work that's been undertaken in good faith, and I think is producing good results. I'd like to see what those are.
Thank you, Dan. Further discussion?
And I would just like to add that I agree with you, Dan, but I think we can and need to go further. I do think time is of the essence, and that's why I would like this to be a priority this year. I do believe that I was elected as one of the main issues. Both Marcus and I were elected this year. We had a lot of votes. We had a lot of people that are very supportive of thinking through reform. And if we fail on this, I don't think I'm doing my job and representing the community that elected me into this office. So I do think you are letting the ball drop if you don't move on this now. So I'll stop there, but.
No, thank you. You've been very clear in your advocacy of this item. I just wanted for people that are watching, just so that we're clear about the goal, because we do have other goals. We have 5.1 that talks about monitoring the progress of law enforcement. We had recommendations come to this board. I believe that's the right step as we move forward. But this goal is to me is too broad and contains things I don't agree with. But I'm just going to read it. Oversight of the police department. Fundamental need given the lawsuit. Engage a consultant to review our policing policies and help rewrite operations guidelines, including de-escalation matters and compliant IA process, required bias reviews, etc. Create a citizens advisory committee. This could start with a human rights committee and empower the committee to make policy changes in this area. We may also want to publicly state that the select board is undertaking a disciplinary review of public safety and possible actions, including suspension or dismissal. Include a disciplinary review starting immediately and take disciplinary actions this year, especially regarding hiring and management of relatives. So that is the goal that's on the table. And I think, especially with this time that we have and the fact that we're already, I'm saying time we have for discussion. I think we've really gone over this, but the fact we already have things in place that I feel are much more narrowly tailored and suitable for our police department in Needham, I would not support this goal, but I'm willing to take a motion either to support it or not support it, because I think I'll give people a final talk, but I think we all know where we stand.
Very least,
this goal.
engage a consultant to review reform actions.
Say it again, Lakshmi.
I said I would, at the very least of the list that is presented in front of you, take steps to engaging a consultant to review police operations.
Thank you for that input. Discussion, how do we want to have a motion to adopt this goal and then discussion on the consultant? Mary Ann?
I just sort of said the question about engaging a consultant again gets to be a monetary item, which would be something that goes to town meeting. And so I'm just trying to think through the steps in the process. I was also wondering, as I'm reading part of this goal, if part of the discussion needs to be when the chief comes back and speaks with us. I think there's some fundamental misunderstanding about the way that hiring and management of relatives works for police. And I think that's something that we should discuss more broadly with the community so that they understand that. So those are just a couple of things that I'm thinking right now. I mean,
Marcus?
And I would like to, as Lakshmi stated, currently about having a consultant and the monetary value that Mary Ann stated, and bring it to town meeting as something that I would push for that process and that next step for that specific item.
Okay, and I guess in my point of view, I think it's premature to talk about consultant until we have the chief in and have more updates and have him and discuss with him and see what progress is being made. I think it's premature at this time, but I'm willing to entertain a motion on both of these because I think that's the way to settle it if the board wants to move forward with the goal. So is there a motion on 14?
Yes, I will make a motion on 14.
Okay, motion to adopt 14 as a goal for item for consideration. As is. Is there a second?
So is that Lakshmi's, I'm just asking
Sure.
questions. That Lakshmi's motion is to adopt item 14 is printed in the agenda?
Yes, what I believe we need to do immediately are all of 14. I am willing to compromise to say that we at least can look to a consultant to help us think through what actions to take, particularly given the pending lawsuit. So I do believe we need to take some action in this domain. And so I think a good step would be to engage a consultant, and whether that goes or however that goes, I'm fine with that process as Mary Ann suggested.
Okay, so to be clear, are you looking to move forward with 14 with the motion, or would you like to have a motion instead to engage a consultant to review our policing policies?
I will move to engage a consultant.
I second.
Discussion.
Just briefly, because we've talked about
Yes,
it.
we have.
I appreciate the concerns that are raised, and I'm not saying that I wouldn't eventually have a consultant. But as I said, we're in litigation now, and I guess one of the things that I don't see how you can thoroughly talk candidly with each and every person that you would want to talk to in order to get the best factual information you can get until after while litigation is going on. And then, as Matt had said, I think we also would like to see how the substantial changes that have been put into place over the last year and are currently in motion now. So if we're all sitting here next year and the same question of hiring a consultant comes up to review review police practices were to come up, and we were somehow had satisfactorily resolved or satisfactory or simply resolve the litigation one way or another, it would be a different matter, but it's not, we don't have an appropriate, it's a significant undertaking. And I would not see doing it now. I think we're on the best course we can be in a complex situation.
Thank you.
Can I add one thing, Matt?
Yes, you may, and then Mary Ann.
So it sounds like you guys don't want to do anything, that you think it's perfectly fine, given the lawsuit and the acknowledgement of, some of the issues that we clearly have, to not take any disciplinary action, no suspension, whatever, because everything, that's fine. And then we are just fine with going back to the police chief and letting the police chief come up with recommendations of a department that we don't think or seems to have some issues, given that there is a lawsuit. So my understanding from this conversation is that we are perfectly fine with that. Is that what I'm to take away from this?
Let me try to speak
Yeah.
to that.
Please don't mischaracterize.
I
Yes,
think,
Dan.
I believe we've got a pretty good police department and some good people that work for us. I think our chief does a good job. I think that we know that things happened in one particular case that should have been done a lot better. And we think that that has pointed us to some systemic problems that don't just affect our police department, they affect our whole community. And we're working on them. But I believe that the best way to try to do that is to work constructively with other people of goodwill and in good faith, seriously and persistently. And that is what the chief came in to report to us on June 8th about. That is what is in our recommendation, our set goal for the draft goal for next year. And I think it's a good task, a good point to follow. Thank you.
Thank you, Dan. I think we have an excellent police department, and I think these wholesale changes wouldn't be beneficial. And I think it's too soon to talk about a consultant until we have more information on which to go on. And if we have to do something in the future, I think we'll have that discussion at this time. Mary Ann, and then I think we're ready for a vote. Yes, Marcus, you want to close out?
Well, so I do think it's important to say that this board clearly thought what happened was not acceptable, and it has not been our position to do nothing. So I don't think that's a fair characterization. We hired a nationally recognized investigator. We got recommendations from that investigator, and we are working on those recommendations. I understand your comment about select board oversight. One of the changes that was made last summer after what did occur was a formal recognition of oversight of any internal investigation, audit processes, so that the select board would be involved with those. I think there is more understanding to be done with respect to discipline. That's not something that this board has a role in. My question for the town manager, and I recognize that in asking it, it's a challenge given that two of my colleagues have said that they don't think it's necessary. But I would have been curious about whether the town manager believes that a consultant would help now with respect to police processes. I know that we've got a set of work that's still in front of Chief Schlittler that he's been working on. But my question is, would a consultant with respect to our policies and our operating guidelines be useful to the chief?
I think it's premature, as you said. We have 34 recommendations that were provided by Nuwari, by Natasha Tidwell, and by Equal Justice and Needham in their 2-volume report. We have crafted the status. We are working through all of them. I think there'll be a lot of information on the police reform law that is going to impact the operations of the department. I don't think it would make sense to review operations until we have that. But we wish the post commission would be moving faster, but I think we've adopted things locally that are implementing the recommendations. I think they're all important recommendations, and I think we're working through them. So I don't think so at this point, but that, like you say, perhaps in the future, there may be something specific that would be useful for us to
So-
get some advice on.
So I very much appreciate that. As far as I'm concerned, this is a topic that is coming back to us. We're going to continue to look at the data from the police, and we're committed to doing that. It's continuing to be a part of our community conversations. It's a part of the work of Nuwari. There is no lack of concern from this board about what has occurred and about our need to make some changes. And I expect that we will all be very much with Lakshmi paying attention to what's happening here and to make active steps for improving. So,
Okay, thank you for that, Mary Ann. With that, I'm going to call for the vote on Lakshmi's motion. Marcus,
Yes.
Mary Ann,
No.
Dan,
No.
Lakshmi,
Yes.
and the chair votes no. Thank you. And we will, as Mary Ann will, in this board said, continue to monitor the situation. Townwide sidewalk improvements, snow removal and safety considerations.
So I can do this one as well, Matt. Unless
Sure,
someone else
thanks,
wants to.
Lakshmi.
Sure. So there are some sidewalks that are done in town when there's snow, and there are others that aren't. And in talking to the public works, the Department of Public Works, it sounds like this is a very old map that was done, frankly, kind of arbitrarily. And Kate may have more insight onto this as well. But so they are looking to update it. I know there is a big demand by people in town, particularly some of our elderly, to have this be part of the town snow removal process. And so if there's a way to integrate that or to revisit how we consider what sidewalks are being done and you know when, that would be fantastic. Again, particularly for some of our elderly residents to have that be part of the consideration. So I know that there are steps being taken, but I'm wondering if we can again make this a priority for us to look into.
Mr. Chair,
Thank you.
we
Yes.
have 2.3, which is evaluate expansion of snow removal efforts. So I think that covers a lot of it.
Okay.
And
Thank you.
I think under your livability goal, number 1, your goal is to prioritize reconstruction repair of existing sidewalks before new sidewalks, and to consider offsetting the removal of old underused sidewalks, which is actually part of our stormwater. So I
So,
think both
okay.
of those things, I believe, cover the topic that Lakshmi was
It
covering.
sounds like it. Lakshmi, are you satisfied with those 2 points? I think we're all in agreement that this should be addressed and looked at, and I think our prior goals incorporate those, unless you think otherwise.
No, I think the specificity around the sidewalk itself, but yes, I'm satisfied if that includes the sidewalk coverage. Yes.
Great, we're in agreement. Okay, great. Any other further comment? Okay, creating term limits for select board, school committee, and planning board. Lakshmi, is that yours?
Yeah,
You said
that's
earlier
probably
on.
mine as well. I do think we might want to consider term limits. I know, no offense to anyone here. Thank you. You know, fabulous service by all. It's wonderful to see town engagement, but I do think it's important to think about having, you know, new voices at the table and getting a way to make that possible. So, you know, I think term limits are a great way to do this. I mean, we see this obviously at the federal level. This is problematic when people are there forever, but it would be nice to have this be part of our ethic here.
Am I correct? Is that governed by?
Was it in the
League
League of
of
Women
Women
Voters report at all?
That's what I can't remember if it's in the league report. I think they did look at that. There's at least data about
You
it.
could talk to them.
And I
about
thought it was
the-
governed by some either mass statute or town chart. Well, definitely town charter.
I think it's town charter, Matt.
Yeah, I
And the
don't know
league
about
does have
mass.
recommendations.
Okay.
Yep.
We'll review. I have no interest in term limits as a, you know, and I'm not just thinking of myself. I just in general think that it's worked, but how do we want to address this? Look at the League of Women Voters information and
I think I would probably rather see us engage the League of Women
Yeah,
Voters and
and
hear
get-
what they learned
Yeah.
as part of their study of these various roles.
so maybe discuss.
We already have 6.1.c, which is the League of Women Voters.
Voters,
You
right.
could add this to your list.
Or a
Okay,
specific
discuss, yeah. discuss the topic of term limits?
Yeah,
What do you think, Dan?
well, I would,
This might affect you. I don't-
it might affect me, but by the time anybody gets the change for the legislature,
Right,
really
that's-
ought to be gone.
Oh,
But one thing is, I hope if you're suggesting term limits for elected officials, you point to the problem you're trying to solve. One thing that I've found, and I've served for a while, so this is
Right.
so, and I've worked in a number of areas where you have policymakers that are politicians, which we are, supervising staff members who are permanent employees. And when you have term limits, you gain certain advantages, I think, in terms of turnover that Lakshmi is pointing to. And the one thing that you lose is a certain amount of institutional memory, and a certain amount of institutional strength passes to the staff from the elected, or in some cases appointed leaders, say appointing agency heads, cabinet secretaries that are appointed by a governor and so on. It changes the dynamic. That's just something that a lot of people don't think about, so I would put it in. I guess in terms of this particular thing, if town meeting, for example, were to pass a non-binding resolution saying they wanted us to study it, well, and I'd be happy to study it. But I'm not sure that will happen. In this case, the league study, which I participated in, they specifically talked about term limits, and they talked about a number of structural changes, and they're in the regulations. They've mainly focused on the question of limiting terms, which we have in at least one case, our Community Preservation Act, for appointed committee members, because they thought that opening that there were reasons that the appointed positions, which are very much out of sight of the public in many cases, had some value to studying, limiting those. And I know that we've talked about that here as well. For better or worse, those of us whose names appear on the ballot, which includes all 5 of the people participating in this conversation, they know that the public has a term limit mechanism readily available to them at intervals of a certain number of years.
Mary Ann?
I would just say fundamentally, I am somebody who's probably more in the term limit fan base than not. But I do recognize that this board, if we were to determine to do something here, only has the ability to make decisions for the select board or recommendations. We cannot begin to speak for the school committee and the planning board unless there were to be a townwide study committee on this particular matter. And I'm not sure that that is my top priority for this year relative to the other priorities that we have. So I guess that's really the thing that I observe right now.
And I think that would take a lot of time and effort. I would be interested in the league's conclusion and also an opinion. I don't know any towns around us who have term limits. So I would be interested if there is something more than the town charter made from town council, but to spend any time on this, I think we've actually adopted a lot of goals this evening. And I don't think it rises, as I said at the beginning of the meeting, to a level of a lot of work this upcoming year. But if there's Marcus?
No, I was just gonna say, so this is gonna go with our meeting with League of Women Voters, this topic, like learning more about.
Yeah.
Learning more
Understand
about
what they've
discussion
learned.
and what they've learned and reporting back and asking questions. Okay.
Good. That's fine. Lakshmi, have the discussion with the league.
Sure. Thank you.
Thank you. And last item on this is school bus funding.
Yeah, this one's mine as well. And
Okay.
the one that didn't make it these are 2 from my survey. It's kind of 2 top contenders were school bus funding, and I apologize, current select board members, but trash pickup was also very high on the list. I mean, and that wasn't on the list here, but I'm going to add that in because both school bus funding, it's very expensive. I have 3 kids, right? It's a big hefty paycheck for school bus, which should be, when we think about town equity and inclusion, it should be covered, in my opinion. it adds a lot of expense. And then, and that could come out of the school committee. I've heard, you know, if that's a school committee budget item, but if not, if we can see to allocating funds for that in terms and really thinking again about equity, inclusion, and parity for transportation. And then I'm going to add on here, it may not be a priority this year, but I do want to alert you that trash pickup is very high on a lot of constituents' lists. So I know the DPW is already aware of public interest in that space. So if you don't want to make it a priority this year, I will remind you that it is out there.
Okay, and I will just say to that, we do have a 1.5. We are going to evaluate the RTS service delivery model, which would include, I think, a look at long-term, well, there it is, long-term investments and curbside. And then 1.6 of the actual public litter issue that we do have. I think we are in agreement that that is an issue in our parks and playgrounds and in our town. But getting back to the school bus funding discussion, I guess for me, I'd like to see it come as a school committee item, but I'm open to.
I was going to say, it's not our jurisdiction. So I do think it's up to the school committee in choosing to bring this. Having spent 9 years discussing school bus funding, I recognize that things change, but it is a significant budget item that they struggle with every year, and that's at the level that it's at. So I think it would be important, you know, I'm sure they will discuss it again. It does get discussed every year substantially, to understand the level of commitment that would be required if it were to be provided for everybody. Would probably take an override, would take an override in the town if that were to be the goal. And in that case, I think the citizens would speak if that was a choice that we made to bring that as an item. But.
Right, or that, and
Yes,
that's why
Lakshmi.
I think, sorry, to bring it up as our goal, right? It could be part of within our funding bandwidth to help the school committee with that funding allocation. But yes, gotcha.
Discussion. I'm not interested in, putting this on for one of our goals to raise to that level. I would want to hear from the school committee, and I was part of the discussions in the finance committee, 12, I'm dating myself again, but in there we looked at options and less of a school bus fee, and it's a very, very difficult task to get school bus funding. But if the schools are interested in looking at it, it'll be a discussion, I think, for that time. Okay. Why don't we, is there a motion? We've gotten through this items for consideration and a very robust discussion. I think we would need a motion. And this, whoever is making this motion should be a wordsmith, because we adopted some and made changes to some to try to incorporate the
Well,
following
give it a try.
initiatives. Thank you, Mr. Matthews.
But if it makes sense, offer motion that the board adopt the goals list for 2022-23, consisting of the draft goals list from the July meeting that's printed, that was in the printed agenda, in the agenda packet, with the adjustments made by vote during the course of this meeting, and subject to review and technical correction. And we could have another vote once, because this is the town manager is going to give us the list. We can have a final vote at the next meeting.
Right, I'd say subject to vote and or consensus, because some of the items we just had consensus on. But yeah,
Do you want to adopt this finally in September? Is that what you want to do?
I think, I guess you've done a lot of drafting down there. Unless there's a reason to make it final subject to technical.
September is
correction.
already the
Well,
beginning
then
of the
I'll
next
say to
quarter. So why don't you
approve.
start working on them?
no,
How about that?
but I think we've had the discussion. We know what this discussion has been, and it would be nice to, I think, put this to bed for the town staff to work on. And
To
get-
approve the list subject to technical correction.
Okay, there's a motion, there's a second.
Second.
Discussion. Okay, Marcus,
Yes.
Mary Ann,
Yes.
Dan,
Yes.
Lakshmi,
Yes.
and the chair votes yes, that's unanimous. Great. Next item on the agenda, committee reports. Is there going to be a Nuwari? I was informed that there's going to be a report that I'll discuss in a moment, but are there any other reports, Miriam, that you wish to?
So we were just gonna quickly mention the Community Conversations Working
Thank you.
Group. That's a subgroup from Nuwari and includes a couple of extra people from the community. Did meet. We had some discussions about what our shared goals were for these community conversations about race. We did discuss the fact that we thought directly having a conversation about policing might not be the first conversation we would have, because it is our goal for these community conversations to be able to invite more people in. And so we thought maybe if we could have something sort of like Kate talked about with the polling, something that could be an invite people in discussion first. So the committee is hoping or expecting now at their next meeting, everybody's completing a survey for Lisa Smith McQueenie to go through what our priorities might be for these conversations. And so that we can discuss why we chose our priorities, what our top priorities are, and our reasons for thinking about them as our next step in this process. Marcus, anything you would add?
Maybe just a little bit more about, we started with thinking that policing should be second or something inviting, but I feel like towards the end of that last meeting, we kind of maybe geared towards maybe policing should be first because of where we stand right now and because of the climate in the community. I feel like we started with that, then I'm pretty sure we kind of went back towards maybe, but then that's what the survey is going to help with as well.
Yep.
Yeah.
And just so Nuwari's, are we still meeting? The meeting schedule is, what's the future meeting schedule?
The goal was to come back together in the fall.
Yeah, okay, yeah.
Okay, and we were hoping that this community conversation group would actually have some first potential discussions being able to be teed up. I'm not sure we're quite going to get there before we bring Nuwari back, but we will sort that out.
Okay, great. And thank you again for all your work on that committee. So heavy lift.
Okay.
Great.
And then I think we do have one last item to
Sure.
talk about.
Yes, you do. And I was informed by the vice chair, the subcommittee reports typically work as you're informed as the chair of things for discussion. I understand that there has been a letter to the board that concerns myself. And I was asked if I want to participate. I spoke with town council, sit here during the conversation. And I thought it best that although I could be here, I think it would be best if I left so not to have any appearance of any undue influence. So with that, I'm going to recuse myself from this conversation and I will turn over the gavel to Ms. Cooley.
Okay.
And
Thank you.
we will, at the end of the evening, say goodnight and I will see you in September. Thank you.
See you in September. Something about that. We have had a citizen of the town who's been with us all evening long who just left, and I think this would have been something that he would have been interested in. So I think as many people in town know, there has been a great deal of discussion about a building project on Central Avenue that the chair of the board has been involved in, and the chair of the Design Review Board. And there have been allegations that have been made about the ethical conduct of both of those members. So I think it's important to clarify what the role of the select board is as it relates to those discussions at the present time. First of all, as I said earlier during our discussion about special municipal employees, of which the select board are not special municipal employees, we are regular municipal employees for the purposes of those discussions. But all municipal employees, regular and special, are required to comply with the state ethics law. It's a personal obligation that runs to each individual employee. So that's the obligation and the expectation. It is generally not the role of the select board to oversee or to adjudicate the compliance of its own members with the state ethics law, nor is it the role of the board to directly oversee the compliance of those it reports
to other town boards. Again, as I said, it is up to each individual, and each individual is expected to do that. The select board does not have the power to order a member to withdraw an application that has been submitted to the planning board. And it does not have the power to instruct a member of the design review board to cease representing a private client. What does happen is that the State Ethics Commission investigates complaints against municipal employees. We understand that a citizen of the town has made a complaint against municipal employees in this particular case. So the select board has been informed that a complaint has been made to the Ethics Commission about this matter. That investigation will certainly run its course. We expect that it will, and it will bring clarity to the extent that there's a resolution from the state. It's important that people know that to whatever extent the Ethics Commission finds that a violation of the law has occurred, and that violation has substantially influenced the action taken by a town board, such as the issuance of a permit, right? That town board may ask the Ethics Commission to rescind its prior action. So that is all information for people to know. I think it's also important for people to know there's been a question about removal of people from boards. This board does not have the right to remove people from boards. We have the ability to appoint, which we do. There is a provision, I'm not recalling whether it's in the charter or the bylaw, which does permit for removal of somebody from a board if they have not been doing their duties and not attending the meeting. And the request for removal would need to come from that board to our board. I also note, as I mentioned that though, that the citizen, in fact, who has made a complaint to the State Ethics Committee is clear that they're not seeking the removal of these members from their boards. They're just seeking the withdrawal of the petition in this particular project. This particular citizen of the town has said to me on more than one occasion that they recognize that the members who are on these boards have served the town well and in many ways, and they are not looking to actually change or interrupt that service to the town, that they understand the value to the town of having that service. So I think we all can appreciate that this has been a challenging time for all of us. It's not a discussion that we've had as a board, and we're not having a discussion this evening. But I did think it was important for people to know that, in fact, the select board, because of the nature of our government, while we are the executive board of the town, is actually not the boss of a lot of things. And to that end, we do not have the power or the knowledge or the skills for adjudicating some of these matters, which is why the State Ethics Commission exists and what its role is in this particular matter. So we're expecting that to happen. I'm really not intending to take questions. I just wanted to lay out what our understanding of the situation is, and that we look forward to the State Ethics Commission performing its role here. I will just remind our board, and in fact, any other boards, that if you have a question about your role from an ethics perspective, that you are always able to contact the Ethics Commission, and they will give you guidance on your particular role. I have done that at various points in the past where some question has come up. They're very good about responding. I believe that the folks who are involved have also consulted with the Ethics Commission, in some cases at more than one point through this process. And so all of that will be available at some point in the future. Okay. With that, I don't know if there are any other comments for tonight, or I would welcome a motion to adjourn.
I motion to adjourn the meeting.
Second.
Any discussion? I know Marcus and I are hungry. I will, and Kate, Marcus, we need to vote. Marcus,
Yes.
Lakshmi,
Yes.
Dan,
Yes.
And I vote yes to adjourn. Thank you all. Good evening.
Good night, Lakshmi.
Night, Lakshmi.
Number 14.